Yeah. You can sit, but you will see that you will move then because we want real interdisciplinarity. 3 people from Barcelona cannot be seated together. Good. Yes. Pedro. We're waiting for some people still, but I think we will start in 5 minutes. So, grita. Oma. Let's start from one seat. In one help. Perfect. One Grazie. Pots tornar a passar enrere? Espera, t'envio les preguntes. Si t'ho mira i comencem. Envia el grup del digital, si pots. Sí, algun grup més. Hi ha hagut d'epidèmics, si vols. Si pots, T'envia les preguntes de tu, Jordi, les tres, són tres. Què fas, actualment? You do explain the project. What are the bottlenecks of implementation innovation in your I wish for implementation. ¿Vale? Gabriela, we start now. You must be for the initial, as Domenico is not here. You are not now. So we for yeah. Thank you for for being here. We are streaming on live. That's why sometimes we will be acting a little bit differently. Thank you very much. Grazie mille per l'invitazione. We're going to inaugurate the inaugurazione. Professore Trombetta, per favore.
Welcome to our university. We are really very proud to host you here in Università Campus Biomedico di Roma and to start with the second edition of the Planet Health Innovation Lunch. The lunch is in the corner, a sustainable lunch, really green, and unfortunately, I'm not here to work with you all today because today is our University Freshers Day. So we have to go to our new student to say hello and welcome, but I'm going to come back after this important appointment in my university. So enjoy your work, enjoy the panorama, and have a nice day and a big work. Thank you.
Thank you. Thank you.
Well, hello everyone. I'm Dr. Gabriela Fernandez. I'm a professor at San Diego State University in the Master's Program in Big Data Analytics, one of the coordinators for the One Health conference. Again, thank you all for coming, and our conference will start tomorrow from October 30th to September 30th to October 2nd. So I hope to see you all there. And again, the idea is to bring all different stakeholders together to bring a consensus between animals, humans, and nature. So thank you again, and I hope to see you tomorrow at the One Health International Conference. Thank you again.
Thank you to Campus Biomedico and to Professor Marcella Trombetta for hosting our conferences, Planet Health and One Health Conference. I'm Margherita Ferrante from Catania University. I work on public health, and I am the delegate of the Catania Rector for third mission. So it is a great opportunity, these very innovative opportunities on planetary health innovation. And so I want to give you my congratulations and my grant for good work in this day. Thank you very much to all.
Thank you, everybody. Now we move forward with the presentations. So, thank you. So thank you very much. As you can see, this is a twin conference. We are happy to start the long conference, but this is Planet Health Innovation, and tomorrow there's One Health, no, Tuesday, Wednesday, Thursday is One Health International Conference. This is the fourth one, and we have been twinned, and thank you very much for the support of One Health to us. This is the second Planet Health, and we will explain a little bit about that in 3 minutes, but let me explain the logistics. You are sitting now in these tables, okay? You can see the different colors of the cartooling, no? I don't know the word in English, but these cartoons. Later, before the lunch, we will get out of the room one moment. We will make, or maybe in the room itself, we'll make a photo with each of you, no, showing a different color, because we want doctors, researchers, bioinformaticians, educators. So please, there is a pen here. There are 3 pens. We will be, I think the students have the pens downstairs, but I need you, the big pen. We will give you the pen, and I need you in 5-10 minutes to write what are which is your background. Researcher, educator, biologist. If somebody is feeling comfortable with 2 backgrounds, no problem. 2 things, okay? Not 10, please, because I know some of you have 10 backgrounds, but I think it's important. And of course, by writing that, if now you see journalist, you have 2 of you have to move from the table and sit in the other table. Because what we want is, in each table, 5 people of different backgrounds. And then there are 4 break or lunch, collab, break, collab. It means that there are 4 breaks. Every time that you will listen 4 or 5 talks, and there is a lunch collab or a break collab, depending on the day. In these collabs, in the lunch, we will be here having lunch with the bags, sustainable bags, and you will discuss between you about the talks that have been delivered before. With 2 questions. What are the bottlenecks of the potential implementations of these innovations in your fields, different fields, okay? I'm a journalist, how difficult it is to explain innovation to these people. I'm an economist, how difficult it is to convince healthcare managers to believe in investment and not in spending. I am a biologist, so each of you a bottleneck, no? I would ask somebody at the table that makes also concentration rising up, writing this small, please rotate in these responsibilities. We will have somebody that will help you, but rotate writing these things. 2 things always, bottlenecks, and then a list of innovations. some of innovations that you will have listened, but why not new innovations? Okay, and that will go all together with the Why Planet Health. So thank you very much. So Jordi, can you put on the list of the participants? You can see different participants. Now I will make you go on with the different participants. Very quickly, thank you for coming. It's not been easy. It's a Monday. It's a Monday. It's in Rome. It's fantastic. Many people from abroad. At the end of at the end of September in the university, so I think it's fantastic for coming. But don't worry if you believe that we are not so many. Important is quality, but you will be part of a network. We launched the first chapter in Barcelona, but we're launching many more soon. You will see in different places, no? And you will be, and we will promise, and we will do it. We will do different features in this website of our network, so you will be forever part of this network, and you will be able to contact all these other members in different chapters. So for you, it's very important to be here, and so on. Thank you. Thank you very much. So this is Marcela Trombetta. This is Pedro Albajar from WHO. You will see him later around here, speaking also. This is Margherita, is here. Ferrante from University of Catania, Nirase. This is Elena Codina from Children's Hospital of Barcelona. This is Domenico Vito. He's coming in train from Milano, so he will arrive later, and he is the organizer with Gabriela of One Health International. This is very important. Claudia Fernandez de Cordova Farini, a daughter of Rome. She's living in UK now. She will be online, many people online. She's very good in nutrition. Alberto Sana, Director of Innovation, Ospedale San Raffaele. Okay, thank you for coming, Alberto. Thank you for coming. Gabriela Fernandez, you know her, from San Diego University, Living Lab. I think it's very important to have somebody from the other part of the world. Chiyun Uyunkar Caniras. We have recorded a video of her from the deep Amazon forest. Fantastic. And she's creating the Amazonic Planetary Health Chair with the Javier Balbuena. Lars Munzer, thank you, Lars, for coming. And his colleague also. We didn't have time to put your photo because thank you for these last moment additions in this. Laura de Gara, I don't know if he's here, maybe not. Sorry, Laura. Thank you. Thank you, Laura. I'm sorry because we had to steal your photos with the risk that sometimes you don't know if they will like. Yeah. Thank you. Thank you. Esther del Toro Campà, Health Director of MERS. Thank you, Esther, for being here. Marta Giovanetti, thank you, Marta, for the support. It's not easy, these things. Francesco Branca, University of Geneva, also former Director of Nutrition at WHO. He will be delivering a nice talk about nutrition. With Claudia, also, I talked before. Javier Balbuena, he's in the middle of the Amazon right now. Some of you met him in the One Health of Greece, also in Barcelona and Planet Health. He is quite different, like many of you, okay? And he's setting up this Amazonic Planetary Health Chair in the Amazon with local people, which is the important thing. Margili, super family doctor. By the way, I'm a family doctor, so it's normal, super family doctor. In Barcelona and the Catalan Environmental Health Society. Carmen Ruiz, the same, the president of the society. Thank you for being both here. Prisco Pizzitelli, it's right now in Dubai. You know many of you Prisco. He told me, Jordi, I will try, okay? He wanted to be here. Maybe he will connect at 3:30, but he's visiting some interesting people in Dubai, and we are very proud of him. Adam Scali, sadly, he had to be here, but his grandmother is in a terminal process, and he had to fly to Morocco, but he will be listening us, and we thank him for being with us all this time. Nerea Blanquet, she is listening us from Barcelona. Thank you, Nerea. She's one of the kind of co-founders of the Planet Health. We thank you her a lot and with all the support. Melissa Jimenez, thank you, Melissa. Now you are in Munich University, and very supportive also. Giuseppe, he's not been able to come from Bambino Gesù. very busy oncologists, pediatric oncologists, and actually the Hospital of Barcelona and Bambino Gesù are trying to collaborate in many things, so it's very important. Silvia Ossia, brava, fantastica, she's been very supportive. She's flying today to Macedonia or tomorrow, so she will be joining online of the United Nations Population Fund. Casimiro Vizzini, thank you, Casimiro. We met in Greece, and thank you right now working in UNESCO, and very interesting background. Lorenzo Gianquintieri, I think he's coming with his card. He apologized for taking the card, but he was from a point. But he's coming. Politecnico di Milano. There's some people that are still coming. Eugenio Luciani, Società Italiana di Medicina, I believe he's coming later also. Francesca Costavile, grazie Francesca for being so spontaneous and nice, from the National Research Council of Italy. Alessandro Berioni, resident of medicine, but I think very involved in public health, international level. You have a champion here, so take advantage of him, Italian champion. Camilla Luigli, Camilla, grazie. It's a photo, eh? Good. Always. Yes, fantastico. You're also like him, no? Very involved in these fields. Ornella Punzo, I don't know, she's here. She will be coming later, they told me. Patricia Ripoll, she's here. Thank you, Patricia, for Fundación Visible. Passionate advocate, very intense, in good sense. At European level, transversal, you will see her in many European projects. Savita Nutan, thank you, Savita. Very interesting topic, medicine without cruelty, no? Not using animals in testing medicine. Andrea Ciucci, he was in the first Planet. He is working, of course, in the Vatican, but also in Cinecittà, in very difficult environments. He's very supportive, and we're very happy he will be connected or trying to send a video. Denis Falson from WHO, tuberculosis, very innovative. He sent a video. He was in another conference at the same time. But one of the places that innovation is really delivering is in tuberculosis, so I think it's very important. Jesus Colina, thank you, Jesus. By the way, Jesus from Badato, a journalist that has been during 30 years in the Vatican, from Spain, but living in between you in Roma during 30 years. So very interesting, and he introduced us, Andrea Ciucci and other people, and we are very thankful to him. Cristina López de San Román, thank you, Cristina, for being here. She's very strong in ethics, so if you have any doubts in ethics, please ask her, which is what she is delivering a PhD on that, so fantastic. Jordi Alcalá, our supporter, our biggest supporter and producer. If you have any event that you need to interact with many people around the world and very creative, please contact him because it's fantastic. And Nuri Ferré also working with him, and quite very interesting personality to style others and to make others shine. I think it's very important in that sense. And myself, so I hope you don't get tired of me. Normally, in other planets and future planets, we have another person presenting. So for logistic issues and other issues, it's not possible this time. And I prefer to do it myself. It's not a narcissistic thing. But if you are tired of me, please tell me later. We can substitute me, okay? Good. So this is Planet. And you can see here why Planet, very quickly. Planet is necessary because, you will see in little slides later, we want to innovate in global health, One Health, and planetary health. Alessandro was telling me, I want to do these things in public health. Well, why not also public health? But the important thing is the innovations in these fields, global health, One Health, and planetary health. This conference, as you will see later, wants to differentiate itself, not only as a conference, because if not about competition, it's about not repeating, no? And people must be focused in different space tempo, no? But to really give opportunity to mix the academic world, the researcher world, and the most entrepreneur world. Researchers in this area, global health, One Health, and planetary health, have an amazing job in front of them. and it's not easy. But also, they have tried to explain these things. But for normal people, it's very difficult to differentiate global health, One Health, planetary health. Academics are very good in many things, no? But sometimes in the communication, and we need all the support. Obviously, global health, One Health, and planetary health have overlaps, obvious, no? And of course, one thing was in the 95, One Health, or environmental health, One Health, it gets growing, then 2017, planetary health. And if you look, really, if you look at the groups that are researching in these topics, some of these people are the same. That in the 90s were in environmental health, then they moved to One Health, then because in their university they're more close to the Rockefeller Foundation or the Lancet collaboration with planetary health, they're inside there. But the groups are there. So basically, however, what is important is to find solutions and deliver solutions, okay? So you will see constantly all these mentions to this disciplinarity. And sometimes you have a product or you have an innovation or project and you can say, well, this is global health, but also One Health, because it's a digital follow-up, we can classify it in global health, of a tuberculosis resistance, no? Etc., or a bacteria resistance in the water. So it's One Health, but not digitally, global health, no? And embedded in the context of X, Y, or Z. This is planetary health. But it's important that people understand that all these things can be implemented, no? As you will see. Jordi, can I have my slides? So very quickly. So in that sense, we want to transmit the feeling that imagine that you are a Star Trek tripulation. Alberto, okay, you are from the Star Trek tripulation. I think you like these kind of things, no? You're coming from outside, okay? I don't know if I have it, Jordi. One moment. So you're getting near to the Earth, no? And you want to see the status of this wonderful planet, the only blue dot planet that we have, okay? By the way, parenthesis, some people have recommended me to change the name of Planet Health, Planetary Health, Planet Health Alliance. Wonderful job, by the way. 6 and 7 of October, the conference of Planetary Health Alliance. If some of you can go, fantastic. No, they're doing that in Rotterdam. And wonderful people, I met them in Malaysia. And I think it's extraordinary. But if we had to change the name, why not? We would call it Blue Dot and Health, no? Because Blue Dot, or planet, and health, no? It can be interesting. So imagine, thank you, you are from outside, and you want to see the status of the Earth in a QR. Could it be possible? Maybe in the future. Status of the Earth. The problem is that we cannot compare with other planets, no? But that would be the status of the water, the status every point, everything. Of course, you would see that the status for us as a species and for other species is very bad. Not for the itself, the Earth, no? So basically, I don't want to go on details. Many of you will talk about these things. You know that there is some limitations, some barriers, and we are crossing all of them, all these 9 barriers. And basically, I don't want to deep again, but many things, sorry for the slides in Spanish, we know that the climate change affects health. There is no discussion about that. And it's a huge opportunity for us to convince others to make things. Now there is COP30, a huge opportunity again to implement. And sometimes what there is political right now, political stance, stoppers, it's the right moment to introduce health, and health to oppose these political movements that maybe health is not so bad for them, okay? So the impact of climate change in human health is extraordinary. Many of you will talk about that, and with solutions also. And of course, the itself, the hospitals and the systems consume. It's a contradiction. You will see one of the most innovative hospitals in Europe, Hospital Fundació Sanitària Mollet, that we'll speak later, that they are trying to solve. And like that, many other hospitals around the world. No? But it's not easy if your hospital was built in the 50s. It's not easy, okay? The impact is clear, and what we want to do, and also in children, I'm so happy that I am a father for since 2 months ago, and my daughter is here with me today. So Amanda is here. And it's obvious, before I already was engaged, but it's obvious when you see your daughter of 2 months old, how important, which planet we're going to leave, no, to our children. So I think it's super important to take into account, and how there are some movements, some politicians cannot be engaged. Probably it will have to come from bottom up, and this is what we want to do. Bottom up initiatives, no, that can really deliver quickly the innovative solutions that already exist. I don't want to be, but when we are explaining to some ecosystems what is all these things, again, it's difficult sometimes. All of you would answer very well, but people don't know what to differentiate. That's why let's focus on innovations, and there's innovation helps in that. That innovation helps in that, and let's do it quickly because we need it. We're part of the planet, all of you, all of us. And I think it's important to solve the problems all together and in an interdisciplinary way. That's why all these events will be like that. And of course, it's about, if you mix that with that, this is just a weekend brainstorming of family doctors and cardiologists 5 years ago. It's very old already, but not so, but 5 years ago, describes the buzzwords. The buzzword is the word of the year, no? This year is the word of blockchain. This year is the word of AI. It seems AI is forever now, but you will see. Sometimes these words get catchy, they stay, sometimes they disappear. Many of these, the important thing is that what can you do with artificial intelligence or natural language processing and epigenome? And this is a faculty of medicine. I don't know if there's a faculty of Polytechnic, of engineering, not far away from here, but in some places, a student of engineering starts to study, and they didn't know, but now they know, that an algorithm they were using for natural language processing for numbers, they can use that algorithm to be used with the cytosine, guanine, thymine, the letters of life. And many, many engineers are working with other partners in the other part of the campus, and they never imagined. Why? Because natural language processing can help with, of course, epigenome, with genomics in general. And it's explosive thing. So if you add all these explosive exponential technologies with all the planetary health approach with different things, with the, people will talk about that, no? With all these social determinants of health, plus all these other things, plus the exposome, I don't want to go deep because many people talk about that, all that, plus the connections, it's not us, it's the Lancet and wonderful people that say that. The connection already exists, plus the AI and everything. We have all the solutions in the world. So it's our obligation to implement them and to try to help researchers to implement. All that, opportunities of systematic integration. Dr. Pedro Albajà will speak now later, will explain about that. No? Here in Barcelona, when Bolivians went to vote for their country abroad, Bolivians, okay, it was an opportunity to check on the votation about the screening of Chagas. Okay, somebody put a bus there, and taking advantage that we were together that day, they took the advantage and they screened in Chagas. They found 16%, Pedro, 18% of people with Chagas. They didn't know. It's opportunities of systematic integration. We have everything, so with all these things, all neglected disease, all new disease, these NCDs, why don't we integrate and we take advantage of opportunities? This is the important thing in innovation, and not to invent a new thing. Space, global health, everything is related. Many of the planetary health people will talk about, Alessandro, when he arrives, will talk about how satellites can help us in that sense. No? Sarah Soto, IS Global. This is the reference. He came, very fascinating photo, no? Her hair, the planet. She has developed with IS Global a kit test of antibiotic resistance. Fantastic, for bacterial resistance in the waters of the plant cities. Who is investing in her? The investment funds are investing in the company 32 of telemedicine, company 32 or whatever. Who is investing in her? With like that, London Tropical Medicine Institute, many institutes here, we have many researchers that have these things. What we want to do, and we're doing in transition, because we don't want to be seen as typical entrepreneurs that only are interested in money. We are doing these events to link the community of research and transport it slowly to the investment phase. And that's why slowly, very strategically, we are doing like that. Not because if you do it like you enter into as elephant in the room, researchers will not like you for sure. So we're doing that slowly. And every time, today, there is already some potential investors. For example, Jesus works in philanthropy. It's very interesting how to invest in projects and make triangulations. And we will be inviting investors, because we need to put the two worlds together. And this is what we want to do in Planet. Innovation for our health or planet. And this is promote innovation in these three fields, quickly. We did in Barcelona, we're doing in Rome, we are agreed to do in Geneva, and in Washington. We're very thank you to the Johns Hopkins University in Pennsylvania Street, 500 meters away from the White House, which is not now, it's not an easy house now. So 500 meters away, we'll do a planet there. So I think it's worthy, and we thank Johns Hopkins University. This is the opportunity of systematic integration. Normally, we could not afford to do in the building on Johns Hopkins in Pennsylvania Street between the Capitol and White House. Take opportunity, you convince them, opportunity of systematic integration, sorry. So this is what we're doing. Barcelona, it went very well. Now Roma, you will see fantastic things today. That was Barcelona. We did these tables, like here today, share, eat. It was not possible for regional, for logic regulations, but that was in a canteen of a corporate. But we did that. No, we ate this Mediterranean food. I think it's important, no? And that each event must be consequence. It's impossible to keep eating bad things during the conferences. So I think it's very important. Dialogue between you, discussions, Minister of Health of Catalonia came to the meeting, and so on, okay? All these things today will happen also. Very quickly, my background, very quickly, I am a family doctor, very entrepreneur, and I start into the world of digital health with many projects. That's why I fall in love with global health. And basically, we ended by working in more than 32 countries with WHO and many other organizations. And basically, slowly, I got in love with neglected disease and other things. And we are doing projects of innovation. So I'm doing my minute of my innovations for not repeating it in the afternoon, and I'm over. Innovations in global health, AI to diagnose all these things, neglected disease and so on. Basically, also in prevention, disease, and we have a small new project called P8, which is for implementing interventions of prevention in medicine with all the Ps, as you know. Personalized medicine, proactive, but we have added 3 more Ps apart from the typical 5. Primary, planetary, and with purpose. It's important. By the way, many things, this is not mine, this is innovations of others. Many innovations can already diagnose biomarkers of cardiovascular disease just with a photo, just with a video camera. So there are many things that can be done. Basically, all these projects are being implemented, and just to show you that if we want to sustain the planet and so on, we need to go to a personalized medicine, preventive medicine, and working all together. Just to finalize, we're launching a book of the future of hospitals, and look, in 1 month, look how aging population, antimicrobial resistance, environmental impact of hospitals, how all the topics that we're discussing now are now in the agenda of the challenges. This is an interview to the CEOs of hospitals around the world. Slowly, they're entering into the agenda of this future, okay? There's no pathologist in the world. We need pathologists, we need many people, many healthcare workers. AI can help with that, but how we can do that and so on. Just to finish, because they're telling me I'm very late, we are very late already. Basically, innovations, many in the field, you will listen to them. Hot summers, innovative things already exist, how we can implement them. Again, that is global. Real-time genomics for One Health. Already it's possible for $800, make real-time genomics in the middle of Africa. Digital exposome, social determinants of health, the district code is good, but now we can measure it. Why these people in this neighborhood is really not feeling well or not living so many years. So all these things can be measured. And thank you very much to be here. We'll talk about many interesting things. We'll talk about this list of innovations. And thank you very much. Yeah, Thursday I was in New York. We were able to convince the Vice Minister of Health, Maria Angela Simão, and we thank you that to Pedro Albajá, which also was very supportive in that. We convinced them of doing a potential event in Brazil, and we're very happy to have achieved that. Thank you very much, and let's go for it. Thank you. Thank you. Pedro, it's your turn now. Pedro will make a small speech. Pedro is the leader of many initiatives neglected disease in WHO, Chagas disease, and will be supporting us. Thank you.
Thank you very much. Deep gratitude and privilege to be here. Yeah. Buongiorno a tutti e grazie il coro per l'invito. To be here, to hear. Why I left WHO and I came here. To hear because when we make silence, we hear. We understand, like, love, we share, dialogue, and finally, we engage. In the last couple of years, we have had a lot of meetings, and it's good news. We are having more and more meetings about estimations, modeling, calculations. But this is the only meeting I know that they are speaking about doers. We give microphone to the ones that are already doing concrete things. Because the best speech, definitely, is the demonstrative project. Let me give you three short reflections. Demonstrative projects. We know that we are not going to reach the United Nations Sustainable Development Goals. We know that we are not going to reach the objective of the WHO roadmap by 2030. We wrote all of that in 2015, 2019, and after pandemic, big crisis, geopolitics, etc. So, more than ever, demonstrative projects are key because they say out this is possible, what is possible, and how is possible to do it. So more important than ever. And don't forget that, even to write the agenda post 2030. So these kind of meetings are definitely very, very important. And as well, of course, to change mentalities, to do a conversion. Because definitely, we are planet. We have to update a lot of things. Even the definition of health of WHO is urgent. There was a revolution in 1948, the definition. Health is the state of complete physical, mental, social well-being, and not merely the absence of disease, infirmity. What about environment? We have no environment in the definition of World Health Organization. Second reflection. Neglected populations. I'm working in a department of control of neglected tropical diseases and malaria. Why WHO is involved in the organization of the COP30 in November. We have the big meeting of environment. We are preparing, working hard. It's actually in the 30 edition, 30 editions, is the third time that we will have a chapter, specific chapter on health. So we are working hard. We have, I'm traveling to Belém, I'm traveling to Brazil 2 times, a worm in the planet, in order to prepare the contents of this COP30. And this meeting is as well very important in order to do that. The biggest challenge is to take into account this bio-social diversity and actually to reach this real coverage, equity. We have a lot of projects, we have a lot of instruments, but what about real coverage? Because neglected diseases means the diseases of the neglected populations, the ones that are paying and are going to pay the highest price of all this climate emergency. Third, the challenge of landing. You know, in aviation, taking off is the easiest part. The most complicated part is to land in concrete things, sustainable, that change our reality. Santos Dumont, Alberto Santos Dumont, actually is considered that the first flight was 23rd October 1906. I mean, he did a lot of takeoff, took off many times, but was just on 23rd October that was able to take off and land without crashing. So, how we can land? We have to study and to approach in a multi-dimensional way. It means multi-professional. We have to call all professionals and to do interdisciplinary approach. Not every crazy doing his work. Design, development, implementation, assessment of impacts with all disciplines. And the biggest challenge, interoperability, not technical, human. Human interoperability. What kills are not the diseases. What kills the planet is not many things, is our negligence. So, here we are, to hear the doers. What about everything from any discipline? Where? Everywhere in the planet. Who? Everybody, everyone interested, curious. How? In a true interdisciplinary way. Why? Because we are planet, and our survival, the survival of the planet, depends on us. Thank you very much.
Thank you. Thank you very much. Leave it, don't worry. Thank you, Pere. We are a little bit late. We have started very late, so no worries. But I will ask people to be as sharp as possible and concrete. And we'll give opportunity to talk more times if somebody has something to say. Now we continue with the innovation in institutions. We want to give the word to Professor Alberto Sanna. Thank you, Alberto, for coming here from Milano, and it's a pleasure to be with you. Thank you.
Thank you. So, thank you for inviting me here. And yes, I will go presentation. I am a nuclear engineer by training, and I founded a research center in Milan by the Hospital San Raffaele, which is called Health and Wellbeing. Oh, sorry, it's called Advanced Technology for Health and Wellbeing. And the title I gave here to represent this in quick words is One Health and Wellbeing in Socio-Technological Ecosystem. I used to have this claim without one at the beginning, because health and well-being in socio-technological ecosystem. Since some years, I introduced One Health and Well-being. So, do I have a button to push, or you?
Sorry.
You didn't want to read this.
Of course.
Okay, so this is a view of the piece of the San Raffaele Hospital in Milan, and this is the living lab of a smart city, because San Raffaele is an entire city basically, where we have private metro, hotels, 4,000 square meters of shops, so a supermarket, libraries, pharmacies, and so on and so forth, and private metro, kindergarten, high school, university, so parking, we produce our own energy, so everything there is in a city, we have it, and we created in the years a living lab for the city of the future, aiming at creating healthier and greener environment. And so this is part of a San Donato group with other hospitals in Lombardy region. And these are the research line that I will quickly show to you with few words. So starting from the hospital of the future to make it easier. And we did several projects dealing with basically robotics and IoT in the healthcare processes, from smart hospitals, cabinet and trolleys and drones and surgical robotics and cognitive robotics and ambulance of the future and so on and so forth. So we make European project or anyway project, and we deliver and we pilot and then we demonstrate and measure. Given that in the meanwhile I was there, they were building a city around me, I expanded my scope out of the hospital of the future in the life of the future. And so we have been developing several projects in various domains, which are behavioral domains, so what you eat, the physical activity, and how you move, and how you cook, how you entertain yourself, and so on and so forth. Here are some very quick examples. This is a real-time smart trolley for the supermarket, where you take something, you put in the trolley, and in real time you have green, red, and blue, so green, yellow, and red, so you understand the impact that this product is doing on your health, on the environment, and on society, according to some real-time control that we performed in this project. And this is a completely different project. We designed a car, it's an electric car, where elderly can go, and people with disability can easily go, because the car offers to you a seat to sit, and then you enter, and is optimizing your posture, and then you have a robot which is carrying on and off the luggage without obliging you to do so. And there are other features of this car that are dealing with a brain-to-machine interaction with multimodal commands that I will not go. But just to give you the sense of the span of the things that we do there. And this is the greener city, in a sense, is we start from redesigning. This is, unfortunately, is still a concept we could not deliver. We could not find the money to do a research project. How to attract the people to come in the urban parks. Urban parks are very underused parks, and they are wealth of well-being in urban environments. 75% of population in Europe lives in the city, and we need to bring them out from the couch and go in the park, socialize, stay in the air. So we invented 16 different gaming strategy to convince people to go in the park and to stay in the park. And then another type of project dealing with the smart city is this Flying Forward, which is the use of drones to deliver medication quickly in our premises, in our hospital, in our smart city, and also to make surveillance to avoid that bad things happen in these big areas. And another type of project dealing with impacting the planet, not only the behavior of people, is this project on renewable energy communities for Energy Island that we developed, leveraging on our cogeneration plant and the surroundings around us, residential area and ours. Another, this is those, let's say, ovals. Each of them are basically, I would say 95% are European Commission funded projects in all domains, and I will just spot one of these on top in the, what we call the Nexia ecosystem, which is dealing with the arts of the future. So we are creating a new type of arts and well-being. For us is very fundamental, and arts also a way to experiment without boundaries of verticals, And we started with a big project dealing with photography, putting together photography, neuroscience, and technology. And then we're evolving with the literature of the future and theater of the future. And just to give you the sense of this, this is 70% of our brain is used for seeing. And so we wanted to understand what that, starting from seeing arts, what does it mean? And we created a platform you can easily find if you go on that internet site with our videos demonstrating how it works. But basically, we started with arts, and then we are using the same platform to understand, and we made several patents out of this, obviously, to understand if we can detect the cognitive decline and the risk of Alzheimer and the increase of risk of Alzheimer from the way you look at pictures. Picture of people that should move emotionally to you. If they are not, those pictures are not emotionally moving you, there could be some problem between your emotion and your, let's say, semantic information of viewing. So this is just to give you the sense of when you deliver in an open field like ours, then you can easily transport in other fields. So to wrap it up, this is the overall project line, and actually I actually put it in the wrong say, sequence, so sorry for this, but this is a wrap it up on this. And you see the One Health project, which is the last one that we started 2 years ago. It's One Health, well-being and sustainability in the blue economy, and we put well-being before sustainability. All the world is speaking about sustainability. We want to have well-being in front of this, because if we have well-being, then you will have sustainability, because well-being is a broader concept. And just we started this project, as I said, I would say now 2 years ago. We started it in Porto Rotondo in Sardinia, and we aggregated 21 startups and companies on projects that are dealing with this. And then we evolved this year. We presented this with, I think, 40 companies in Nice during the United Nations Ocean Conference in Nice in France in 2015. And these are just like the type of companies we involved, and we help them to develop things which are coherent each other, not just things that are on spot. And we do this in collaboration with the University of Côte d'Azur. And I think it is the final slide to give you the sense of the ecosystem we are aggregating on One Health for the blue economy. Thanks you.
Thank you. Thank you very much. Wonderful job. Huh? It's not 2 days with that job. So with us we have now Margherita Ferrante. Thank you, Margherita. So please.
Thank you very much. If you launch the presentation.
Margherita.
Okay.
Margherita.
I talked with you of innovative application of artificial intelligence in public health in University Hospital of Catania. And our works started from the from the digital transition that was asked by National Plan of Recovery Resilience. We have transported this necessity on the health scenario. The health scenario is changing in the last years, and the sustainability of National Health Service is heavily weighted toward the diagnosis and treatment by the population aging, the steady rise in chronic disease, and the global dimension of public health threats. For example, emerging and re-emerging pathogenic viruses, environmental disasters, extreme weathers, and so on. So we have to go toward a different approach. From a risk reduction approach, we have to go to population approach to have a better prevention, evolving health scenarios in connection of the general practice, hospital services, primary care, public health services, and mental health services. And for the sustainability of the universal national health system, we have to strengthen prevention, but for the feasibility we have of the large scale prevention, we have to use digital technology, how we have seen from the previous presentation. And prevention and digital are strictly linked for to support the surveillance system for acute and communicable and chronic, complex, and so on, for predictive models, preparedness, and more generally tools to support prevention throughout the lifespan. So big data is important. We are implementing the knowledge on big data on the student in the university and on the healthcare personnel for to have more knowledge on artificial intelligence, the difference with machine learning, and meaning of data science, deep learning, and so on, and to apply this instrument to different healthcare processes and to different prevention processes. How the literature have said, we have many publications on the application, for example, of Internet of Things in the healthcare system. That is very important. And there are many concrete and active applications from the AirSense, for example, in Italy, for the dynamics map of pollutants in urban areas, the Good Environmental Insight Explorer, analysis of environmental urban data to reduce emission, and so on. And artificial intelligence is applied in many sectors at the moment, but in our hospital we have applied Intelligent of Things for to monitoring the quality of the hospital unit, the quality of operating room, of intensive care, because it is very important to have the monitors in the intensive care for the climatic, for the air quality, but also for the movement of the personnel for to defend by infection related to the hospitality. So we have we go on. We have made many applications, but the best application at the moment are free. One is the application of artificial intelligence for the treatment of the tumoral cases. The registration of the cancer data and the artificial intelligence was applied for to have a selection of diagnosis with oncologic relevance, and we have a precision in this application of 99%. So it is very important to apply this innovation, because the personnel of cancer registry don't lose the time to register and to classify the cancer data, but to elaborate the cancer data and to have many suggestions for the prevention, for the cure of cancer, and so on. This is for us very important. Another project is Indico. Indico is an application for the identification of chemical and biological contaminants to defend by the chemical and biological, radiological and nuclear events in the wars or in the country where these biological, chemical and radiological threats can be spread in the population to have damage. So we have made the application of artificial intelligence for to catalog all this data and the data are inside. So when the people go to intensive care, or especially in emergency rooms and of the hospital, immediately the system link all the data and say to the personnel if there is a special alarm, that many people in the same time have similar manifestation of symptoms linked to chemical or biological or radiological threats. So we have in the hospital, in the university hospital, a system that immediately can give support to these people, but also to give the alarm to also the people, the institution, for to contain this mining. And the other application, and the last application, is the application of artificial intelligence in the DARE project. DARE project is very important because we have a national plan with the PNRR, with the University of Palermo, with the University of Bologna, and CNR, Emilia-Romagna, Veneto, and so on. And the project is DARE, Digital Lifelong Prevention, for to take together health data and environmental data. Link health data at national level and environmental data at national level is important because the cross-link of this data can permit to us to make idea on which are the most spread minas in the population, which are the system that we have to put in field for to contrast the health situation that are more present, and also to fight climate change and pollutants, pollutants in the our cities. So we have an urban mining that guide us to make prevention not also on the health but also on the environment pollution. And this is the architecture of DARE, the system that we have applied at national level, and also all the sub-projects that are linked with DARE for to make a better prevention and to have a good health and a good system in the Italy countries for to give also models to other countries. Thank you.
Thank you, Margherita, thank you very much. It's important to see that the people from One Health are very, very updated in all these fields, transversal. So we move forward quickly. Dr. Elena Codina from the Children's Hospital Barcelona will teach you about the PEJUs and many more things. Thank you.
Thank you. Give me the... Yes. Thank you very much. It's a great pleasure being here today. Yes, I'm Elena Codina. I'm a pediatric nephrologist, but in 2023, we created a new unit in our hospital named Pediatric Environmental Health Specialty Unit. I work here in St. John del Hospital. It's one of the main pediatric hospitals in Europe. And that's an old photo because it was from the first day of our unit, and now our team has it's bigger, but I don't have any new photos. So I hope that next planetary health journey I will have this new photo. That's the official definition of what pediatric environmental health is, but I prefer talk about the exposome. I don't know if you already know this concept. It has been very well worked for the IS Global from Barcelona. It's just to explain what kind of exposures have an impact in our present health and in our future health. And I think that you already know that we have some external exposures. So it means if you live in an urban place, on a rural, for example, which kind of contact you have with green spaces, etc. But we also have our personal exposure, that it's our habits of life, and it's also important to take care about our diet and how our toxic chemicals exposures at home, for example. And all these have an impact on our biological responses. And I think it's a better way to explain what environmental health is, and it's very important to take care about that when we talk about children. This is an infographics from 2021, and it's to explain which kind of exposures we are worried about that our children are exposed to. For example, air pollution, the effects of climate change, the materials we use in construction, for example, etc. And also here we can see also the concept of chemical and endocrine disruptors, for example. Yes, pediatricians always like to say that children are not small adults. They have some biological, physical, and behavioral conditions that make them more vulnerable. So I don't know if you already know, but it's easy to think that all the organs and systems of children are immature, so they cannot defend themselves as an adult. They breathe more times per minute than an adult. They take more food per surface than adult, so the intake of possible toxics is higher. They are smaller. They breathe more near from pipes, for example, or from particles, dense particles that are near from the floor. They are curious. They put everything on their mouths. So it's our responsibility to protect them and also take care that they will live more years than the previous generations to this more polluted environment. So it's important to take care about that, and they are more vulnerable than adults. But this vulnerability starts also from before the conception, and it's important to take care that what we do can have an impact in the future generations, and that's also important to take care about that. So I think that more of you will already know the effects of climate change. It's not just that the temperatures are higher, they have a very different impacts in different aspects. But I want to remember that also this will have specific effects. They will have specific effects on children. And remember that children under 5 years of age will suffer up to 28% of the burden of disease attributable to climate change. So next years we will see that this population will be the more vulnerable to be exposed to this climate change, or the effects of this climate change. And I like to share that slide because when we talk to health professionals, we already know that we have a lot of pressure on assistance way, and we have a lot of work, but I want to remember that professionals of health, we also have responsibility to take care about this, no? That we have a very big role to take care about the lifestyles and how we translate that to our consultation, and we have a great big power, I think, to try to change things. And one of the innovations I want to explain today is the creation of these units. I don't know if you already know them. The first one was created at the end of last century in the United States, and they are called PECSU. And they are the Pediatric Environmental Health Specialty Units, and they have been expanded around all the United States, but they have this definition, no, that you can read here. But at the end, that we are pediatricians specialized on this environment and how that affects on the children's health. But we don't work alone. We work with the other specialties, other health professionals, and also from other fields. And I will explain you a little project we have done with some engineers and architects, as an example that we must transform the world altogether. And these are the main objectives. And we are not public health. And our aim is to translate all this scientific evidence to our consultation. I want to change things when I talk with the families and when I treat children. This is the United States, as I told before, that it's all organized with some centers that act as the centers of the SPECSU, and the others that exist in the world are all in Spain. The oldest one is that in Murcia. There is another small one in the Garrotxa, it's the north of Catalonia. And in 2023, we announced the creation of one of these units in our hospital, Sant Joan de Déu. And we don't, as I said, we don't want to work alone as a new specialty. We want to put a new glasses to see our assistants with this view of planetary health, with this new view that what we can say on the consultation can have a big impact on the global health, and try to make these clinical systems a little bit different with this new view. These are our areas of action. Our main area is the assistance, as I said before, but we also do some research. We train and teach some other professionals. We do some activities with promotion of health, and we also work on the environmental sustainability of our hospital. These are the types of consultation that we are doing now at the moment. And we are doing a lot of activities in the universities, community projects, and training, and doing what we can. And research is what I wanted to explain you about. I wanted to talk about AIRA. That AIRA has been a project that has been granted for the Ministry of Industry of Spain. And we have created a platform to study the environment where our children live, in these patients that we have hospitalized at home. We already know that we are called the indoor generation. We spend between 80 and 90% of our time in indoor spaces. So the air, the materials, the air we breathe inside of our houses have an impact in our health. And that's extremely, no? But we are putting a lot of materials, toys, paints that have an impact on our health, and we must study that. And there is a lot of papers talking about the impact that would have to work on the houses of the patients that we have in the consultations. We can see the effects of damp also. Well, I want to explain a lot about that, but there is a lot of evidence, but we are not asking a lot of times about how these houses are of our patients. No? And with that platform, we introduce clinical data, contextual data about the materials that the patients told us, and also about the materials we see when we go to their houses. And we want also to study the data inside their houses with these sensors that we have created, and also with georeferences and obtaining the data of quality of external air also. And with the help of IS Global, we have created different kind of indexes to see which kind of impact or the sum of these aspects have on the prevention, on the creation of these pathologies. And that is our command center. We have the possibility to control all this data from a center of our hospital. And in the future, we have asked for 2 more grants to amplify the number of patients. And the end of the project will be that there will be a nurse or a pediatrician controlling the quality of air and creating a specific and personalized different aspects to say to our patients, advertisements to say that, sorry, be careful about that, or you can change that, or maybe we can control that there will be a better or a worse prognosis on the pathologies of our patients. And I think that's all, and thank you very much for your attention.
You can see a pediatrician hospital with a Cortex room that was like, the NASA. Controlling. A nurse-in-chief will control in any moment all the hospital. I think this is where we go, no? With humanity, of course, with humanity. By the way, We have Marta Paisa with us to show us what is a green hospital and many more things. Go ahead, Marta.
Thanks. Well, thanks for having us. I'm an environmental scientist. I'm not a practitioner, I'm not a healthcare, so I'm just talking about landing from Mr. Albahar. I have been landing in something that is called Planetary Health Development Center, that is a joint venture between IS Global and FSM, Fundació Sanitària Mollet, which is one of the top green hospitals in the world. It sounds a little bit cocky, but still it is. We have lots of awards regarding that. So I wanted to share with you a few ideas of going from a green hospital, a sustainable hospital, which is something that we should already have, even though it's not a common thing, to a planetary hospital, a planetary vision. So this is what we are dealing now since this last January. So I want to share with you really fast this 15-year evolution of healthcare sustainability at Hospital de Mollet, which is a small town 20 kilometers from Barcelona, showcasing this innovation, since we are in an innovation community in hospital governance, cultural leadership. And so I will go from past, this early adoption of green design, to the present, that we are becoming a planetary health pioneer, linking human health with the community that we serve. And finally, a few reflections about how a hospital can be a catalyst for planetary health in the community that we are serving. So really fast, Fundació Sanitària Mollet is just an ecosystem of medium-sized hospital. It's not one of the top hospitals in Barcelona, but a medium size. And this is something cool because there's lots of medium-sized hospitals in the world. So it somehow makes sense to replicate this type of ideas. It's acute care hospital, palliative, and also residences for the elderly. And as I have said, it's just where serves 171,000 people. So it's 11 municipalities, 11 town councils, which takes a good, you have to have a good humor to deal with all these mayors and health technicians from these 11 cities around. And the point is that from 2010, sustainability was by design in this hospital. So you can see we have 6,500 square meters of solar panels already, because it was built in 2010 with sustainability built into its own architecture. So we also have more than 148 geothermal wells, rainwater harvesting. I'm going very fast, Jordi, but there's a lot of things in our website, ready and cooling roofs. 100% of the electricity is renewable, and we recycle, well actually we separate 25 waste types. So when you think about usually hospitals, we separate 9, 10, but 25 is kind of a high number. Of course, we have this semi-automatic drug dispensing system, this type of to avoid medication waste, and lots of more things. We have everything in our hospital, and it has to do with also with dining rooms. It has to do with avoid non-needed tests. And we think that it has to do with 4 pillars: government's commitment, participation of professionals. We have 25 people that are ambassadors, environmental ambassadors, for every process of the hospital. And next to that, we also have, of course, architectural general services involved in the scope 3 that we are dealing with now. So to go fast, the sustainability ambassadors empower staff to drive this type of initiatives. Governance and purchasing, which you all know, it's the big when you talk about carbon footprint, 70% has to do with scope 3. And when we talk about, we have a net zero hospital, you know the trick. It's scope 1 and scope 2. The carbon that is we are offsetting is only from this size. And we have something that is really cool, mandatory climate environment training for all of our employees. They have to train, and it's not only about how to separate waste, this type of waste, but to learn about planetary boundaries, what they can do in their own consultation. And it doesn't matter if you're a top doctor, top cardiologist, or you are someone working in the kitchen. You have to be trained. You have to know why we talk about planetary health in our hospital. And just today, my colleagues are in Geneva, sorry, in the Joint Commission International Auditory. They are being in a test to win one of the sustainability healthcare certifications. We will be the fourth, if everything goes right, the fourth hospital in the world to achieve this level of sustainability certificate. One first, Singapore, Geneva, and Africa, and we will be the fourth in the world to receive. So we have received the Healthy Futures Award. I mean, lots of certification, because if you reduce your carbon, you should also share the knowledge. So first you have to be recognized by, and then you can share the knowledge, and this is what we are doing now. And jumping to the planetary vision, we are trying to go from green to planetary. So broadening this type of horizon, we are thinking that we can go beyond the clinical care, we can go beyond the walls from the hospital, because it's not only about climate change, it's an everything change. So from this vision, as an environmental scientist, we are reducing everything to CO2. And you all know that it's not only about only CO2. So with these planetary boundaries that Joris just said, now we already have the new version, the 2025 version, so we have crossed 7 of the 9 planetary versions. So our vision is that we should also create a healthy environment for the people that we are serving from the hospital. So that's why we launched it just 9 months ago, the center that I have the honor to be the director of. And we try to use this hospital with this sustainability career to be a living lab connecting research from IS Global to practice in the consultancies and beyond. So we're trying to combine IS Global Science with FSM healthcare delivery. You all know IS Global, so I'm not going to explain who we are, sorry. But we have these 2 work areas. Decarbonization and environmental sustainability in healthcare. This is something that happens indoor the hospital. And then the community-based planetary health strategy, that are things that are happening beyond the walls of the hospital. How we do that? Mostly knowledge. We will have the honor to serve as the new Planetary Health Alliance European Secretariat since the January. And we are also involved in this and learn from these collaborations for planetary health. And as I was saying, we are teaching our professionals and professionals from Catalonia and sharing our knowledge, because as Dr. Al-Bahar said, it's not only about taking off, but it's a lot about lending. How we do this nice vision, this sustainability discourse. When you go to the consultancy, and I don't have a white, how you call that, una bata blanca, a white. So it's not that easy to talk with some healthcare practitioners that they should take into account that maybe heat waves will affect double women than men. So this type of knowledge that they are not used to learn, and I was not used to learn about human health, I learned about solar energy and a lot of things. It's an interdisciplinary approach that you have to be a little bit humble, let me say, to embark to it. So, education and training, we also create a lab that is in front of the hospital. This is Hospital of Mollet. So here we have a visual narrative of the planetary health solutions, indoor and outdoor. I'm going to callar a mateix. And we are bridging the gap between research and systemic adoption. This is why we are mostly paid for. It's a matter of adoption too, not a matter of inventing or finding or research. That, of course, we need to research, but then where is the gap between research and systemic adoption? Not just pilots in different places, but something that can be national. We are developing something that I'm very proud of it, because it's a big challenge to create a shared agenda for Vallès Central, which is a region that we just invented for this reference area that the hospital has, and try to create interventions on air, food systems, mobility, and green spaces with different actors of this territory. It means health technicians, it means companies, it means also people from public health that are not from hospitals. There's lots of funny things around. and also people from natural parks that are involved. So this is the first meeting that we have had. And they were really eager because they have the same in their own agendas, but when you collaborate, it's much more fun, and of course, solutions are much complex, but they have a bigger impact. Something that we all know, but when you land it, it's not that simple. So finally, beyond 2030, can we have a net zero hospital with the scope 3? This is something that I leave in the table as a reflection. Can we integrate planetary health into healthcare professionals' practices and patients' lifestyles, exposome that Elena was talking about? Can we transform the environment, that the population that we serve from a hospital? Can we align policies, clinical excellence and environmental stewardship? And can we embed climate and planetary health into strategic plans of top management? This is things that I have in my mind. This is something that we can talk later on about how we can scale all those impacts. And finally, let me just share that I understand that planetary health, One Health, global health, whatever you want to call it, at the end is kind of the same sometimes. I think that planetary health is the next frontier of healthcare. We have to, you have to have a green hospital, a sustainable hospital. This is like complying with the law. Let's put this in this situation. If you're sustainable, it's okay, it's nice, it's fantastic, but it's a thing that you have to do, you should do. It's something that it's not, that shouldn't be that innovative. The innovation now, I think, is going beyond this CO2 scheme and go through the walls of your own hospital. That's it, thank you.
Marta, fantastic. You can see the Joint Commission is, is a network, to put the brand in private hospitals mainly, and they are security oriented, but also business oriented, and how they have seen how it is important, that future. So we can mix. It's not about people thinking in green. No. Big business is coming, not only for the security of the planet, but for the business. So how we can put this business people oriented in our roof. This is very important. Congratulations. It's a massive hospital. It's surprising, this hospital. It's not because it's my region. It's surprising. There are others, but it's big advantage, 10 years only all. So it's fantastic. But the mission and the brain is there. Thank you, Marta. And thank you for coming the day that the Joint Commission is in our hospital. It's fantastic. Thank you. Today, now we're going to have lunch, but please, already somebody has written. Start to pass the can you pass it? Keep writing it. We'll get each of us a bag to it, and we will start in the tables. Please sit down, at least 3 people in the table. We eat nicely, and we start to talk between us and to answer bottlenecks, what you have already seen, and your wish list for innovations, okay? And after that, we will make a wonderful photo here, okay, with the colors. So please write, what are you, okay? So we're gonna now distribute don't move. If you wanna go to the toilet, of course, or you wanna go something, or just stretch, but we're bringing to you the bags, okay, of course, and stretch a little bit before eating. Thank you, champs, thank you. So, keep moving. Okay, keep moving. So, after having eaten, it's the best moment to have one of the best experts in the world. Yeah, thank you. We have the honor to have Dr. Professor Francisco Branca. He's from Rome. He's an expert in nutrition. He was the former director of WHO of nutrition, and now he's a professor of University of Geneva. Thank you, Francesco. Go ahead. Thank you. Thank you. Applause for him.
Yes, microphone is on. Hi. And I'll be sharing this section with Claudia Fernandez, should be, I hope, on the call. So, I'm talking about food systems. By that, I mean the actors and the actions related to the production and consumption of food. So we're talking about the food supply, the food environment, and then the choices of the consumers. What are the problems about food systems? Big problems about, okay, can you help me with that? Do I point here? No. Or down? Okay, okay, thank you. Okay, so what are first of all, the challenges? Sustainability challenges. Okay, so first, the impact on health. And food system impacts health through multiple pathways: unhealthy diet and malnutrition, chemical contamination of the environment, occurrence of zoonotic disease, antimicrobial resistance, and the health of the food workers. So multiple ways to do that. Only the unhealthy diet and malnutrition is responsible for 1/3 of the global burden of disease. We're talking about probably 16 million deaths every year. And then the other aspect of food system, and that is the impact on our planet and on the many of the boundaries. Here you can see what we have been able to somehow connect with the food system. Greenhouse gases between 24 and 30%. The use of water, fresh water, probably 2/3. The use of land, also about 1/3, 40%. But also nitrogen and phosphorus use, leading to eutrophication of waters and the reduction of biodiversity. So these are the challenges. As you can see, many of them. Claudia will talk to you a little bit more about the zoonosis and One Health approach to this. But now, this is about solutions. So I'd like to tell you some categories of solutions, because of course there could be many in food system. And the first, well, maybe first, before I go into the categories of solution, I'd like to show you this one. This is an analysis about what is going to happen in the next few years about the food system. Of course, population will increase particularly in cities, and we will go further in crossing those red lines about the planetary boundaries. So in this slide, you can see the red lines, the red bars are what is going to happen if we don't do anything. So let's say that there's about 3 categories of solution. One category is technology. The second category is actually changing what we eat. And the third one is reducing the waste, which is a lot. You know, we waste about 1/3 of our food, either because we cannot keep it when it's grown, or because we waste it on our table. And please don't waste what is actually left in your packages. Use it again in another opportunity, because that's what we do in this part of the world. We actually consume and overbuy, and then we waste the food. So now in these bars you can see actually that only The fourth bar, which is the one in dark blue, which is the combination of those strategies, is actually going to address at least part of the issues. We're not going to be able to get rid entirely of crossing the lines of the planetary boundaries, but we can do quite a lot. So this is, for example, what FAO has said on the, let's say, attempting to stay within 1.5 degrees of the Paris Agreement in the food system. And in the different areas of the food system, livestock, fisheries and aquaculture, the crops, the diets, soil, forest, the food loss and waste, clean energy, and how to do it with good data and inclusive policies. And you see here, actually, there's a number of very interesting technological solutions. I'm not going to illustrate them in detail, but probably just inspire you and tell you what could be this technological solution. I mean, certainly at the production site, even in the livestock, which is, as we know, responsible for a lot of crossing those borders, improving the efficiency of the feeds, but also the improved genetics for the livestock, might actually reduce that impact. But it's about production systems. It's not about the amount. It's about production systems. Biodiversity, we have a lot of poultry. Actually, the number one animal that is producing meat is poultry. So we should be able to reduce that. And then second is the livestock. But there's a lot we can do, for example, on in the use of water in the production of crops. We can use precision agriculture for that. We can use artificial intelligence. We can use remote sensing. We can use satellite imaging to predict the points where water is going to be needed. So there's a lot that we can do in freshwater saving. And then, of course, using more and more what we know is the solution, really, which is regenerative agriculture. And that will actually stop the use of nitrogen and phosphorus, which is the one where we already have crossed the planetary boundary. So the first sort of category of innovation, which I would like to propose to you as a large area, is the technological innovation. A lot of it is relying on digital and artificial intelligence. But then probably what we need to do is changing our diets. You see here that the potential mitigation effect in the production of greenhouse gases by different kinds of diet is pretty large. In this country, there's a tradition in the south of Italy, in rural areas of the south of Italy, of what we call the Mediterranean diet, which is a diet largely based on plant food and on occasional consumption of animal source food. That is, of course, a very useful way to reduce greenhouse gases. But you see there are other ways, like the flexitarian or the vegetarian or even the vegan, which is even a higher potential of reducing greenhouse gases. So how do we change the diet? And you see here that the kind of diets we have globally is incredibly exceeding what would be recommendable, both on the health ground and environmental ground. You see that this is what we call the EAT reference diet, which is a flexitarian diet. But if we compare the consumption in the world to this dietary pattern, we see that we consume 3 times more than what would be appropriate in the world, with large differences. In this part of the world, or in the United States and Canada, the consumption is even more. And this part of the world is exceeding a little bit less, but overall, there's a scope for reduction of animal products, particularly meat and red meat. And you see the other areas, the smaller ones, that are the ones that should be improved. So, particularly the legumes, the fruit and vegetables. So there's scope here for a lot of policy innovation, but also technology. And on the technology, I'd like to talk about novel foods. Can we replace animal source foods and animal source proteins with alternatives. And yes, we do. There's a lot of interesting elements. There's, of course, traditional diets, which use, for example, a lot of legumes. How can we bring it back in our diets? But we also use a lot of new sources of proteins. Now, we can process insects, for example. A lot of cultures do that. So, it can be brought in our cultures as well. We're starting to use algae, microalgae, and fungi to use as a source of protein. They're extremely energetically efficient. We have to use better the blue food, so the food from water, and particularly algae, and we can use much better other byproducts of our production. And then there's a whole space for the new cell-based technologies for different kinds of animal products, meats, fish, poultry. But I'd also like to talk about the policy and the social innovation. Food systems are largely based on increasingly concentrated production with large manufacturers, with large distributors wholesale. Can we actually promote a bit more what it's called the territorialized food systems? So going to the local producers, local markets, small ones, and also having ways to connect them, to connect the small farmers who would not otherwise survive with the consumers through social enterprises. An example of those is the Open Food Network, and helping local producers valuing their products better. A lot of good reasons to use territorialized food system, both on health and environmental ground. At the moment, local food production is in very good, very important in some parts of the world. Still in Asia, for example, or in Africa, we have a large proportion, probably 80%, which is territorialized. In our part of the world, is going beyond 20 or sometimes less than 10%. So how can we actually recuperate territorialized food system, territorial markets? And then in terms of policy innovation, I'd like to share with you, I think, the importance of public food procurement. So the public resources buy every day hundreds of thousands, if not millions, of meals. These meals can be made healthy and sustainable. Think of school meals. Think of, where's the Mollett Foundation? Think of hospital food. If we can make hospital food healthy and sustainable, that would be an incredible contribution, not only to people who live in those hospitals, but to the whole food system. So, yeah, that's my dream about what food system should look like. And I'll give it to Claudia.
Your colleague Claudia will connect from, I don't know, Rotterdam or UK, and will complement your vision, I think, if you want also.
Hello? I'm just trying to see if I can
Claudia,
switch
you're
the slides, or if someone... Am I switching the slides, or...
I can't hear you.
Hello? Can you hear me?
Yes, okay.
Yes.
Fine.
Yes, hi. Because I see you're sharing my slides. Will you be sharing them, or am I sharing them? Like, am I, or is it my? Ah, okay, amazing. Sorry, I got confused there for a second. Technology is not my asset. It's not my best suit. Give me 1 second. Okay, I can now see the slides. And I think I'm able to switch them. Can you see what does it mean to take a planetary health approach to food systems? Okay, amazing. Okay. Well, it's great to join you. I'm sorry I couldn't be there in person, and so amazing to follow after Francesco. I'll try to add some complementarity to the wonderful answers he already gave us, and talk a little bit about what do I think it means to take a planetary health approach to food systems. I would like to start by talking a little bit about the historical background of One Health. I want to begin to talk about One Health because it shaped how we've come to think about health in relation to food systems. It's important, though, to consider the historical background of One Health. It's a term that came from One Medicine, and it was focused on how do we integrate human and veterinary medicine, particularly given how much diseases cross across species. And then over time, One Medicine came to evolve into One Health and expanded to try and include that environmental lens. But in practice, that integration hasn't always fully happened. And most of One Health efforts still focus on infectious diseases and operate largely through a very biomedical lens. So identifying pathogens, responding to outbreaks. So One Health gave us this very powerful language, but its application has remained narrow. And that's a limitation that my work and Francesco's work is trying to push against. So how do we further integrate that? And what's the relevance of this for food systems? So just looking at emerging infectious diseases, if we zoom out and look at the drivers of emerging infectious diseases, they're overwhelmingly environmental and structural. More than 60% of Oh, really? You're not able to switch?
The
You're not able
slides
to
are not
I'm
moving,
switching
yeah.
them. Ah, the slides don't switch. Okay, sorry, thank you. Okay, give me 1 second. Okay. Yeah? Okay, amazing. Okay, I'm just gonna try, and it changes when I move them. Yeah? If I go like this? Yeah, okay, good. Okay, so going back to emerging infectious diseases, more than 60% of them are zoonotic, but they don't emerge randomly. They're tied to how we use land and how we produce food, from agricultural intensification to industrial livestock production or antimicrobial resistance. All of these are factors that disrupt transmission pathways between wildlife, livestock animals, and humans, and increase the risk of emerging infectious diseases. So we have a large contradiction here because we know that this risk is shaped by food systems, by how we relate to land, to animals, to ecosystems, but yet our responses often tend to ignore these factors. We treat outbreaks as sudden shocks rather than outcomes of slow systemic change. And here I talk about like why One Health needs to evolve and expand. So often we think about the problem in two sort of different ways. The first one is the biomedical lens that focuses on the final link in the chain, the pathogen, the human host, the moment of transmission. It asks, how do we stop it from spreading? Then there's the ecological lens that asks, what are the conditions that make spillover events likely in the first place? What political, economic, and environmental forces are shaping this vulnerability? And these lenses have very different types of responses. The biomedical approaches aim to contain, and the ecological approaches aim to prevent often. So by addressing the structural conditions that create risks. And when we talk about One Health, we're often talking about integration, but that integration can look very differently. And at the moment, out of a mapping of like all the different types of One Health networks, that mapped 184 networks worldwide, 60% only included all three networks. 40%, which is almost half, doesn't still think about ecological lenses. So how can we take the ecological lens? One key aspect, key approach, solutions that I think are interesting to think about in how do you move towards the ecological lens is early warning systems. Right now, you can see how much we take that biomedical lens in how we develop and how we think about early warning systems. These systems are often seen as the next frontier in pandemic preparedness, ways to anticipate risk before it spreads. But most of them are still built on biomedical assumptions. They rely on case data, on social media signs, and trigger alerts once people or animals are sick, once a disease has been detected. But they leave out completely the environmental and structural indicators that could help us act before that point. Things like habitat destruction, irrigation expansion, intensive livestock production, climatic shifts. All of them are drivers of emerging infectious diseases, but we don't really think about them in how we think about early warning and response systems. So we end up with systems that detect risks only once they're already manifesting in the human and animal population, and not the underlying pressures that are making these risks inevitable. So I want to talk about a bit of a different system and a different approach that try to take a more integrated lens. So for example, the Environment Epidemiology Network in Greece try to integrate human and animal human, animal, and environmental health data. So what they did is in Greece between 2009 and 2010, malaria had already been eliminated, but they kept on having cases reoccurring that were re-emerging, despite previous existing control programs. So in response, the the European Environment and Epidemiology Network stepped in and they suggested a different type of approach. Rather than waiting for more human cases to appear, they asked, what are the environmental conditions that are allowing malaria to return? What are the environmental and socio-economic conditions that are allowing malaria to return? So to bring that answer, they brought together a range of environmental, socio-economic data, looking at seasonal vegetation patterns, land cover, irrigation practices, temperature, and they used this data to model and map areas that were ecologically suitable for malaria transmission to hold again. What were the areas where malaria was reemerging and what were the environmental socio-economic factors that the reemergence was linked with? For instance, they found that warmer temperatures and areas with intensive irrigated agriculture were especially at high risk. So with that information, they developed these risk maps and they share them with local public health teams. And they use them to conduct targeted place-based interventions. So early vector control, focused surveillance, and awareness campaigns in the right areas before outbreaks occurred. And the result is that they managed to completely stop the reemergence of malaria. And since 2013, malaria hasn't been endemic anymore in Greece. And I really like this example because what it shows is that early warning systems don't only have to rely on human health data, they can be built on ecological insight. And that shifts our understanding of the problem to think about the conditions that create vulnerability in the first place. It's also a great example of cross-sectoral collaboration between environmental scientists, epidemiologists, and public health that are working to prevent and not just react. And what's striking is a lot of the variables that they monitored, land use, irrigation, warming temperatures, they're directly shaped by how we manage food systems. So it's not just a health intervention. At the core is also a food systems question. And often these questions are intertwined. And while this is an example, it's actually been reproduced in different places and in different programs like ID Alert in Europe. The Shanghai Multi-Hazard Early Warning System also uses that integrated approach. And I think these are the types of anticipatory systemic approaches that a planetary health lens can help us imagine and also scale. This is the map of sorry, I'm trying to move the size of the Environment Epidemiology Network here. You can see them. So governance is also starting to expand that direction. So internationally, before the One Health program integrated the WHO, OIE, or WOA, now the World Animal Health Organization, and the Food and Agriculture Organization. And now, since 2019, it's also brought the UNEP, United Nations Environmental Program. And they're starting to think about how do we bring the environmental lens and put together a joint plan of action around One Health. But it also raises the bigger question, you can bring the environmental sector, but what does it mean integration in practice? What does it mean to actually shift how we understand that problem? Because it's one thing to add the environmental sector, it's another thing to shift how we think about the problem, how we imagine solutions. So that brings me to sort of my next question, which is how do we think about food systems also as food for everyone? And how do we recognize that health is co-produced and that it emerges from relationships between people, animals, ecosystems, and economies? And I want to try and give an answer to that question by showcasing an example where food system wasn't thought as something that was for everyone and one where it was, and the differences in outcomes that happen. So the first one is in 2009, during the H1N1 outbreak, the Egyptian government ordered the culling of over 200,000 pigs. And that was framed as a public health precaution, a way to prevent the transmission of the virus. But actually no pigs had tested positive. And the decision was not only based on scientific evidence, it was driven by the biosecurity kind of logic and much deeper also social-political dynamics of sentiment against anti-Christian communities and that use the Zabbaling as well, and were the communities that use the pigs in their practices. But what was ignored in this whole process of culling under a public health precautionary measure is the role that these pigs played in the ecosystem, not culturally or religiously, but also ecologically. So the pigs were really intertwined with the livelihoods of this community. And the Coptic Christians, what they did and how their livelihood was based in Egypt was through the recycling of waste. So they collected the majority of the waste, around 80% of Cairo's garbage, and the pigs would eat the organic matter, and with the rest bits, they would recycle them and they would sell them, and that's how they would make a livelihood. But when that system, when the pigs were taken away, the system of recycling also was taken away. And a few months later, the waste started piling up all over the city, and people had no choice than dump it across like things like illegal irrigation channels, for example. And it triggered a range of public health problems, diarrheal diseases, sanitation-related infections, increased water contaminations. So here in this example, a decision taken in the name of public health ended up undermining it because it failed to see pigs as part of the infrastructure of health in the first place. Now, on paper, we might have thought about this approach and we would have thought, oh, they were taking a One Health approach. You know, there were concerns of cross-species transmission, of zoonotic risk, there was coordination between public health and animal health sectors. But it's one thing to think about across these sectors, and it's another thing to think across species in a way that acknowledges agency, interconnectedness, and care across them. So this wasn't only a technical oversight, it was also a deeper failure to recognize the pigs as ecological participants and more than just disease vectors. They were an essential part of the functioning of this system of waste, livelihoods, and well-beings. So often when we build frameworks that integrate the environment or planetary health frameworks, we need to be thinking about how much are we challenging the underlying logic of previous one. And I think we need to pause for a moment and ask, are we merely integrating across sectors for human benefit, or are we fundamentally redefining what health means and for whom? Are we supporting reciprocal relationships between species and
Claudia.
between ecosystems?
Can you wrap up?
Yes, this is I had one more slide, but I can wrap up. I can miss the last case study. I'll just say to close the presentation is, what does it mean to take a planetary health approach to food systems? I tried to present two sort of ways to think about it. The first one is a systemic risk lens, which is to try and anticipate and prevent the cascading risks that food systems generate. And the second one was the lens of care and inclusion, and asking how do we build food systems that truly work for everyone, humans, animals, and ecosystems. And the point I was trying to make is that those perspectives are the same at the end, because reducing risks and building food systems for all are not competing goals, they're interdependent. And taking a planetary health approach to food system is not only expanding what's in the table to add environmental or animal sectors in our risk models, but it's also rethinking what health is, what food is, and who it's for. And once we start to do that, the recognition that health is co-produced and food, it brings the recognition that health is co-produced and food is very relational. And then the answers of how we think about all these problems start to shift. I wrapped up very quickly because I know there's also delays there. But thank you for hearing me, and I hope you have a lovely rest of the day.
Thank you.
Claudia, as always, you did very well. As Claudia is a wonderful person who's doing the PhD. She's been working with you also with WHO in Southeast Strategy Asia, and you go always very deep, Claudia. So we thank you for your effort, and I think it's very important to have these new generations, having this holistic vision. So thank you very much, Claudia, and we must now wrap up in a small break. But thank you for supporting us again and again. So with that, you want to comment something? Or?
How do you want to do this? We do the discussion in the working groups?
Yes. Now we have to retail a little bit. We had now a 15-minute discussion. We'll have a 7-minute discussion, but we can introduce a little bit, if somebody has some questions to Francesco, okay, to make a quick question. But then we have to delete the 15 minutes break for just one of 5 minutes break. So let's do a couple of questions for Francesco now, and we'll make a 5 minutes break before going to the next one, okay? So who has some questions for Francesco? If not, I can have one.
We do the break directly then.
We can do one question.
We're trying to introduce this planetary health vision of food in our hospital, for not only for the patients, but also for the cafeterias, for the cafe of everybody. And we are trying to, we create a list of requirements for the provider But I mean, it's not easy. I mean, because you're comparing proximity and eco-certified and proteins and vegetables. It's kind of a messy. What would you consider first or suggest?
It's super difficult. And we have some good examples, but we definitely learn, we need good practices. You mentioned the word proximity, absolutely critical. If we have, again, large multinationals or supermarkets providing you the food, we're actually not making it that transformational. But then you need something else. You need to work with, the economic system, with the agricultural system to be able to create that, in Spain you have, in Catalonia you have producers, but they need to be connected in an efficient way. There's a problem of supply chain, of storage, problem of prices, the way you do the bids. So there's a lot of work to do, but this is definitely an important area. I think, it would be good to have really a collaboration with you. The hospitals in New York have made it. They've managed, for example, to reduce by 30% the consumption of red meat, and it's United States. So so it's possible, but we need good solutions.
Thanks. Another question in relation to the solutions there, the waste and the diet more specifically. Do you have a bit of experience successfully to share with us in the sense of those issues and those solutions being having indicators that are followed by like public policies beyond the confined space of some health space, but yeah.
Yeah, I mean it's definitely possible. Waste. Particularly it's been done in our part of the world, and examples like those who transfer the food to food banks, or what is called too good to go. So ways that use applications, apps. That's where innovation is useful, and people go there and buy at very low cost that food. So that is actually reducing. Ways also to help people plan their shopping. We waste a lot of food because it's just there in the fridge, and so that helps. That's good examples. On the production side, I think there's more of an investment, but storage facilities for horticulture. There's a lot of waste in horticulture, or there's basically storage facilities that prevent the development of aflatoxins in grain stored for too long. But that's where the investment is needed. Changing the diet, yes. Of course, we have a lot of very good examples of changes in the diet that are developed. Particularly, we didn't speak a lot about that, but food environment policies that use, for example, regulation of marketing food to children, pricing policies, taxation. To shift the consumption. So, that regulatory. The public food procurement, in a sense, is one which could be more finding people's consensus and not having a lot of oppositions from the large manufacturers. But it has to be a combination.
Thank you for your presentation. So you talked about a lot of different examples of healthy eating, and I completely agree with you. But for example, in the US, a lot of the food that is organic or healthy is very expensive. So what do you say for people that are, or even developing countries that are just trying to survive, and this whole idea of organic is not something that they are considering or even thinking about? It's mostly about survival. So what do you think regarding developing countries?
So, we do have an issue of food security because, the healthy diet is not accessible to 3 billion people in the world, which is half the people in the world. But the problem is not the cost of the diet, is the purchasing power of people. So I think, there is a big agenda on social security, for example, including in the United States. How can we have adequate social security providing support for healthy food? Now, low-income countries, largely the ones that produce in low-income countries for subsistence produce sustainably. So I don't think necessarily we're targeting them. We need to target their capacity to produce and be food secure. So it's all the food security measures that we have to consider. I think the sustainability agenda is more for the middle income countries for the high income countries. That's where we have to both change the consumption pattern, reduce animal source food, and work on the production, which is actually crossing those planetary boundaries. Yeah.
Thank you.
Thank you very much. With that, we close that part. Thank you, Francesco. It's huge opportunities. Huge opportunities in New York. Be aware. Some days you will say some good news about your cook in your cooking in your hospital. We have to really shorten even. We have been told that some people are taking planes later, so we are almost 1 hour late. So we're gonna cut this break. Just 1 minute, please. Stand up 1 moment. Stand up. Okay. Just a little bit of a stretching. Okay, a little bit of stretching after eating. Okay. Just breathe. My grandfather used to do that every morning, 5 times. He told me, you don't do nothing of that, you will die sooner than me. And yeah, he lived many years. So keep stretching. 1 more. Okay. Thank you very much. I think we'll have to cut. Wonderful discussion, Francesco. We move forward to the next topic. Okay. And we are now talking about innovations in pharmaceutics in the sense of decarbonization, policies. If still is with us, I hope so. Silvia Usai, okay, working in UNFPA now. She's Italian also, super expert. She will talk about some policies on that. Then we'll have Nerea Blanquet about decarbonization. And we'll have with us then our super family doctor, Mark Gili, that will speak about the inhalers, okay? So let's go for it. After this session, then we'll have to move to the pitch sessions, which people will have to be here. That's why we're pitch competition. And in a sense of talking 5-6 minutes. I told you 7, but now we have to reduce. And really 5-6 minutes from here, okay? Like in a competition. The academical wall is over, okay? So now we go to competition. So let's move to the next speaker online. Thank you. So Silvia? Silvia is with us. Hello, Silvia.
Yes, hello, good afternoon, everyone, and thanks for the invitation. This is really a wonderful event, and my congratulations to you all.
Yeah. No, thank you. Sorry for being 1 hour late, but we are here, and thank you to you. We still don't see you now. Fantastic. Silvia, thank you very much. And I know tomorrow you are traveling also, so thank you very much. Go ahead
Yes.
when you can.
Yes, so my name is Silvia Usai, and I have a double degree as medical doctor and doctor of pharmacy, and I'm specialized in international healthcare management, economics, and policy. So in the last decade, I have been working across different organizations, WHO, UNIDO, UNFPA, and I have co-authored several guidelines on healthcare. And overall, I'm also first and the last author of many peer-reviewed publications, including The Lancet and other big journals. I have quite a vast experience working in fragile contexts like Africa and Central Asia. And I'm currently working for the UNFPA as the coordinator of the Regional Alliance for Cervical Cancer Prevention in Eastern Europe and Central Asia. And today I'm here to discuss with you why pharmaceutical matters for health and the planet. So basically, already in 2022, I have co-authored this publication in Frontiers, which discussed about the decarbonization of the healthcare system in Italy, particularly, and basically the key insights from this piece are the fact that healthcare system is a huge contributor to the environmental footprint. And if we were able basically to translate, let's say, the business sectors into countries, we will see the healthcare as the fifth largest contributor to the global carbon footprint. And indeed, globally, for example, UK has been among the first committed to zero net emission with its NHS. However, only few countries have followed its example, mostly because looking also at the global policies, we see that the EU Green Deal is very much focused on climate change adaptation rather than emission reduction. And this is an issue also with the translation of policies from the EU into national strategic plans. What I believe it's very much important is to understand that in Italy, for example, the carbon footprint provided by healthcare system accounts for 4% of the global emissions, which is a huge amount. And this is also because we have quite old buildings. Definitely, this is a major leading factor. The infrastructure is a major limitation. However, we have a very good opportunity with the National Recovery Plan, which has basically for the healthcare two pillars. One is linked to the development and the strengthening of primary healthcare, and the other the telemedicine. So these are two major measures that we can take at the healthcare system level to reduce carbon footprint. So the expectation is really that in the next future, building on the lessons learned from the National Recovery Plan, we will be able to further reduce in Italy the carbon footprint. There are also, let's say, local challenges which are related to really the pharma sector. For example, I wanted to show you this study. This is almost 10 years ago, in 2017, has been published, and we analyzed basically the consumption of pharmaceuticals related to COPD and the link to air pollutants in a specific area in Italy, where we have this textile and let's say fashion land area, so a big source of air pollution. Why this still matters? Because in the meantime, we have seen published the EU Pharma Strategy, which is very much focused on the reduction of emission from the pharmaceutical sector, and in particular the use of sustainable, let's say, resources and also consumables. But obviously, if you find yourself working in such areas where you have a huge amount of medicines and also medical devices that are used because of the pollution, using, let's say, reducing the use of consumables will not help. Imagine also that many devices that are used for the respiratory diseases, they have also short shelf life. So this is everything is contributing to the carbon footprint. And we have to understand how to move ourselves toward greener pharmaceutical systems beyond what has been done so far. Because, as I mentioned, one of the major constraints is the fact that there is a big investment and big commitment towards climate change adaptation, much less with regard to the carbon footprint reductions. And definitely sustainable procurement systems and frameworks can help. All the logistics, for example, for the healthcare, the life cycle approach, so from design to disposable. We have also the opportunity to learn lessons from other governments and multilateral organizations, and definitely to incentivize greener research and development and production. Also, the plant production of the pharmaceuticals has been one of the major topic for investments within the past MFF of the European Commission. So how to improve the efficiency of the pharmaceutical plants, which overall means reduce also its carbon footprint. I believe that we should never underestimate the fact that improving our green transition should not compromise access and equity and equitable access to medicines. And this is also one of the pillars from the massive investment that the European Commission has done, for example, through its Team Europe initiatives. And I'm referring here specifically to MAV Team Europe initiative, so support to local pharmaceutical manufacturing. The largest ever amount that has been committed to support local production of medicines and vaccines, particularly in Africa. But obviously, everything has started with COVID and the shortage that the world has experienced with the COVID. So certainly, Africa has been very much penalized, but also in Europe we are facing these issues, and we are seeing this every day with the shortage of specific medicines. So the support to local pharmaceutical manufacturing is one of the major areas of investments to increase the resilience of the healthcare systems and the reduction of the dependency to other countries, and to the import of medicines, which overall contributes to the reduction of the carbon footprint. Every time we should also keep an eye into a gender and equity lens, particularly looking at how women and vulnerable groups respond and how can they benefit from our other policies. Here I'm just mentioning some of the very well-known policies about climate change and carbon footprint reduction. So we discussed previously about EU Green Deal, so the pros and cons related to the fact that there is a big focus on climate change, less on the reduction of emissions. And the pharma sector, so it's interesting that the EU pharma strategy instead puts much more emphasis on environmental sustainability of the pharmaceutical sector. Many WHO and UN guidance have been released, also on local pharmaceutical manufacturing and how to improve access to medicines, leveraging greener technologies. Here, I would, given also my role with the UNFPA, I would be happy to briefly discuss with you something about that. It's a bit probably underestimated, which is how national strategies can really contribute.
Silvia, sorry,
Yes.
sorry to interrupt you. If you can warm up a little bit, wrap up, a little bit, because we are very, very late. And
Yeah, I
sorry
think
for being late.
I think I have 2 slides more.
Good.
Yes.
Thank you.
So this is about reflecting a bit how national strategies can contribute to the integration of climate health frameworks. For example, the HPV vaccination policies. So obviously increasing the vaccination coverage can help overall to reduce the burden into healthcare systems, and this is also outside policies that, let's say, support primary healthcare practitioners. No, so all the policies that can contribute to reduce the burden of access to the healthcare systems can at side contribute also to climate health frameworks. So finally, my last slide is just to wrap up and to invite you to reflect about how to integrate pharmaceutical sustainability into national health plans, strengthening regional cooperation, for example, lessons learned across countries. So always keep an eye and look how can you inspire yourself to do better, leverage digital technologies. As I mentioned, primary healthcare and digital health are two of the major pillars into reducing carbon footprint for the healthcare system. And definitely we need to mobilize domestic financing, which means also contributing to local pharmaceutical manufacturing. Thanks. Over.
I think if you still have some time to listen to the others, I think your experience is very important. And many of the persons here in the room, some of them working in hospitals, some of them working in agencies. So I think it would be important to have a cooperation between you all. Okay? Sylvia is still with us? Yes. So thank you, Sylvia. I think you can contribute a lot in the regional and national plans, and I hope they get in contact. If you stay with Nerea and Denmark, concrete examples of all these things that are happening. Thank you again. Thank you. So, Nerea, go ahead. Nerea will speak about decarbonization. As I told you at the beginning, Nerea helped us a lot to set up this first planet in Barcelona, and we really thank you to her. And here it is. Thank you. Go ahead, Nerea. We're very late. I trust you a lot.
Thank you.
Efficiency.
Hi, everyone. Let me know if I go too fast or if you need me to stop faster, okay? I think more or less give me 7 minutes, and I think in 7 minutes I will finish. First of all, my name is Nerea Blanque. I am not a doctor, I'm a pharmacist, and I have devoted all my life, most of my professional life, to work in pricing and reimbursement of medicines. So I help pharma companies to negotiate prices, okay? The last 2 years, we have seen that more and more authorities are trying to get sustainability components into price negotiations. That's why I started to become an expert in pricing and sustainability. And that's why I started to work with Jordi to see how we can help to promote One Health initiatives and Planet Health initiatives. Okay? I go to my next, this is me. I will share the presentation. And today what I'm going to do is to speak about drug repurposing and sustainability, a little bit related to what Sylvia was saying. Yes, pharma industry needs to do some actions or can do some actions in order to improve sustainability. And not only sustainability, but also ESG in general. So environment, governance, and environment, governance, and sustainability, the three, okay? So now, drug repurposing it can mitigate the environmental impact because it eliminates the need for new compounds discovered, which is highly resource intensive. And then repurposed medicines, though, even they help a lot to decrease contaminations due to drug discovery, really, they are not treated in a way that gives them a little bit of an advantage. Even they are generics that you repurpose and then Unfortunately, they don't get much prices, therefore high prices, therefore pharma companies decide not to invest much in them. And in this presentation is to show that, please, why not we go towards it? Why don't we do more drug repurposing? What is drug repurposing? It's or repositioning a new drug, so find a new therapeutic use for a product that already exists. Reformulate a drug in dose, in pharmaceutical form, in route of administration. Sometimes you will see an example later. We can have a drug with less dose, same effect. Is considered to be a drug repurposing, and contaminates less because, of course, chemicals contaminate. And finally, drug combinations. You can do a fixed dose combination, etc., in order to have benefits in, for example, patient adherence, etc. This is the three. This is drug repurposing. The benefits, as I said, on the left-hand side, you can see reduced R&D resources. Why? Because, of course, normally drug discovery takes between 10-15 years. With drug repurposing, maybe it's 2-3 years. You use less resources. It's more sustainable. Also, it gives you lower manufacturing footprint. The production processes can be optimized. So good for the planet, good for people. And really, so it has less environmental burden. It encourages a circularity model. Very important for the circular economy principles of reuse, reduce, and recycle. However, this is a little bit theoretical. More research needs to be done on this. In theory, drug repurposing is good, but we need to do more and more research. And as I told you before, normally, drug repurposing, a drug that has been repurposed is priced as a generic. 8 years HTA process, so the pricing and reimbursement process is complex, doesn't reflect sometimes sustainability, they don't take it into account. They have limited patent protection. Yes, so repurposed drugs are what we can call non-sexy, yes, undervalued. Now, 3 case studies for you to show you how drug repurposing can help. So one of them is on recircularity, what I told you before, the circularity. The other one is on global access potential. And the final one on pricing potential. So this one, the waste reduction one, it's an example of a hospital that they decided when they use oral anti-cancer drugs, there was some remaining that they didn't use, they used to throw it away. And they did a study, they presented a study where they showed that they could reuse it and therefore reduce waste, also reduce environmental emissions, etc. The second case study is one I particularly like because it's about artemisins. Artemisins are used, well, they come from a plant, from Artemisia, and they are used for malaria. Then a drug discovery team realized that it has potential as anti-cancer therapies. As you know, artemisins are used in many countries in the world, low in middle-income countries. It's already there. Then this repurposing, this new indication will imply that many people or many patients in low and middle-income countries could have access to potent anti-cancer drugs in several indications. Okay, so drug repurposing can have we can help to cure illnesses in many places in the world. The problem, as always, the price is not exciting enough to do an investment. And then the case study number 3, it's a company A, this is a real case from a client of mine, that redesigned a drug with less concentration with the same efficacy, and they could demonstrate that they were contaminating less, they were doing waste reduction, etc. However, when we spoke with payers to see which price they will give to this drug, as the drug had less dose, they would say, in this case, we will give them half the price. Okay? So the company was a little bit upset because, of course, half of the price for a generic, all they have done, it was not recognized. So we have some lags for drug repurposing, even if it has the potential to have new treatments with the same drugs that can help many countries in the world and many patients in the world. Some recommendations, therefore, as you have seen the lags, the industry, maybe they could start to think about why don't I do drug repurposing? Why don't I stimulate my pipeline doing that? Yes? Why, and then payers and regulators, why don't they start to think, why don't we do indication-specific pricing? And we include environmental criteria in procurement, that it happens many times already in procurement. But this price, no, this price, premium price, I don't say to have to charge millions, but yes, maybe a little bit more than generic price. This is not happening at the moment. And then researchers and academia to generate evidence and expand data sharing on why it's so important for sustainability drug repurposing. We need to make it more important. As a conclusion, 3 main points. Drug repurposing connects innovation, market access, and sustainability, and offers the potential to improve affordability of drugs and enhance global health equity, something that Silvia mentioned before. We need to start doing this type of actions. Then also misalignment on the decision-making frameworks. We still need to have some policies, some regulatory reforms that can help that to integrate environmental measures in decision-making and also to have better prices for these drugs. And then a call to action. We need to speak to all stakeholders, to pharma industry, to policymakers, to people that is investigating, to see if we can help to drive the ecological value of drug repurposing. Okay? I know that I've spoken very fast. If you have any questions, please send me an email or contact me through LinkedIn and I will answer all your questions. And I also have like all the bibliography that I used. Okay, so if you need any information, let us know. Thank you. Thanks, Jordi.
Thank you. We don't have time, but we will follow with questions to you. We will have a real strong community after this planet because now we have more time. And I think that there are many possibilities. You are trying to sell that to pharma. I think it's very important. You are doing quite well. And I hope we can really make that happen. Okay, so any last sentence, Nerea, what do you want to say? Do you want to say something else?
I would like to, all of you, to fight for a more sustainable planet and swim against these new sort of policies that are appearing that are a little bit anti this. But I think that altogether, I hope that we can get together to a better place. Okay.
Yeah. Nerea, Professor Francesco Branca is asking if you can give us an example of you have put some cases, no? But an example of, you mean, Francesco? Yeah, an example of repurposing. An example of repurposing.
Yes. Of drug repurposing, for example, the one that I did with artemisins. Yes, the one I said that artemisins are used for malaria, and they have discovered that they can be used for cancer, for example. But there are hundreds of examples of this. There is an association called Repo EU that it's only helping drug discovery experts and different pharma companies to see how they can do repurposing.
Yeah. No, obviously that could lead us to a full day conference, repurposing of these drugs with AI. They're doing that with AI. For the environmental factor, but also for the social determinants of health. And we could enter, here we have people of the Children's Hospital of Barcelona, experts worldwide in rare disease. The fact that there are many rare disease treatments that are not implemented, but they exist, no? And not to say what happened with the new CAR-T technology and all that is a lot of money, no? So it's a question of we have the technology and not the money. So we could be full day, but I think we have to put you in contact with many of these partners here and to go on. So thank you very much, Nerea, and keep pushing.
Thank you. Thanks a lot.
Thank you.
Bye.
Thank you. We have a concrete examples now with Mark Gilly, super family doctor. Yeah, super family doctor, because it's demonstrated that family doctors make people live longer. You know that. So yes, go ahead. Thank you. So the micro. Thank you. And the slides.
Changing aquí, no?
Yeah.
This one?
Yes.
Well, good afternoon. It's a long day. Is it working? Yeah. It's a long day. And I think I'm going to be very concrete and very short. I'm a general practice doctor, and I'm in the Catalan of Environmental Society, okay? And we focus in environmental medicine, okay? We are inside the planet health, but focusing on human, how it affects the human. So we have a working group of chemicals that has made a position paper about inhalers, and that's what I'm going to today to explain. They've said that the health sector would be, if it was a planet, the fourth largest emitter of greenhouse effect. So that's why we need to act, and we did something about that. And what is the most important impact is that the use of fluorinated gases, such the one we use in anesthetics or propeller in inhalers, they account for up to 5 to 10 of the health sector footprint. So that's an important point to take care about that. You know this propellant, the presurited inhaler. I'm sure all of you will have used it in your life because it's the most prescribed inhaler that is used in the emergency when people has difficulty of breath. So it's the most prescribed inhaler in the world, and in Spain it's 45%, in Italy it's mostly the same, but there are some countries that it counts up to 70%. So we really need to take care about how it impacts on the environment, because there are other dispositives, there are devices, but the footprint, they're like 40% less. 40 times less the affecting the greenhouse effect. So we should look what can we do about that. What Environmental Society is asking and is explaining is that these fluorinated gases has a compound, okay, that it converts into PFAS. I know that you should know what is PFAS, and we'll talk about it a little bit. So, yeah, sorry. Okay, so now there is the regulation of the fluorinated gas, is a European regulation that we should reduce and eliminate all the compounds of the fluorinated gases. The thing is that these propellant and these devices, they have a chemical compound what is made of a fluorinated hydrocarbon fluorocarbon bond that is very strong, and it cannot be degraded by the biology, and it has a it has a properties very chemical interesting because it repels fat and it repels water. So you can find it everywhere in the manufactured things. You can find it PFAS in the water, in the paper devices developed that are in contact with foods. You can find it in the industry of cars, of the engineering, of even with your chemicals, with makeups, so it's all over the world. And the ECHA, the European Chemical Agency, has made a warn if someday the world be out of these forever chemicals, because the thing is that this bond is so strong that takes a long time to degrade, and it keeps contaminating like the groundwater, and then it gets into the food chain, so it gets into us as well, so it affects us as well. So we have some things to do about that. This is the compound that now is the propellant that it's being used. That it's difficult chemicals that to follow the trace, how the name. So now it's 134, and all of these three compounds are just the same, that the one that we're using now. And now they are moving again for a new green inhalers, another chemical compounds that there are those about that, 1, 2, 3, 4, and 1, 5, 2, that they are said that green inhalers. Why? Because they have not so high footprint, and they are similar to other dry powder devices, okay? And they are said that they are not toxic. They said that they are not persistent contaminated. So it's supposed to be a good solution for the health and for the climate. But what the ICHA is wondering if they're really going to not to contaminate the groundwater because it's difficult to degrade. So what's going to happen with all the planet? This is a think about that everything goes into the ocean and it comes back to us. So this is just how to make you concerned about the difficulty that has the medical doctor when it has to treat a patient. We have lots of devices. Now they are not pressurized. We have brought dry powder inhaler, and we have another techniques. And remember that we have the old-fashioned nebulizer, but now we have the more innovation things that some of them even you can use it all over the world with only a mobile device. So we have alternatives just to treat patient, always checking how patient can manage, if they can SOCSA has made this graphic just to help to choose the proper device, depending if the patient has the capability of make a deep breath, a deep inhalation, or they have the capability of coordination, because there's some devices you have to press, you have to inhale, and some of them they cannot do that. So this is what SOCSA can wanted to make this position just to help the people change. And always remember that the best and the greenest inhaler is the one the people can use and will follow it, and the patient will be more controlled with the devices that knows how to use it, okay? And remember just to recycle always, because even the inhalers, they have some gas that if you don't take it to recycle, it will contaminate just the atmosphere. I wanted to be short, so this is what I wanted to say. And that's it.
Thank you. Oh, thank you. Thank you, Mar. Thank you. I believe that in the last conference, we had two pharma companies competing between them to show what is the best. In this time, we don't have pharma companies to be even more free. I think it's important to be free, but it's important how from the bottom it can be. And congratulations for your English, Mar. Okay, thank you, thank you. So we have to move forward. We have to cut again the break. I'm so sorry, because we have to move to the competitions. Just in case, we can have 1 or 2 minutes break very quickly. Talk between you. If you have to get up one moment for a coffee quickly, but just in order. And we start in 2 minutes. In 2 minutes. The innovation pitches, and we will start with Francesca Costabile. Yes, because your colleague has to go, and we have an order. So, Casimiro Vicini, you were the first, but you will be the second. Okay? So we can go to the toilet. Yes, and you can come back. Yeah, sorry. So Francesca, start coming here. Prepare. Yes, please, together. So start to be prepared. And in 2 minutes, we start, okay? It's only 1 minute left. again, and sorry again. So we will start. I know you have some of your slides. Try to be here as much as possible. So you have the feeling that, you can see there also your presentation, that you have only 5-6 minutes really, because if not, we will not. Okay? So we will start with the first, your feet, eh? So, we start this new chapter. I understand everybody. This is a different mindset. It's really 5-6 minutes. We'll make some exceptions with some people that are trying to do it in English for the first time, but the rest of us, 5-6 minutes, okay? Let's go.
5-6 minutes is just to read all of the people involved here. In any case, there is me and there is Anna Maria Tomare. Next slides, please. Okay. From here, we will try to give you an assessment of urban health. Urban health is a concept that in the literature has been considered for many years. There are several papers here that you can look. Now the benefit of living in urban areas are not so, higher than on living in the countryside, in the high-income countries. Why? Why? Probably because the mortality now burden in the high-income countries has been decreasing because your doctors are so good. But the years lived with disability has been increasing. So since during the pregnancy period, and we know because we are working also on it, the children, our babies and children have been experiencing more years lived with disability in the high-income countries. So this is the rationale. But why? This is a kind of research that we cannot do alone. I am an atmospheric scientist. Anna Maria is a gastroenterologist. There is Gloria Bertoli here, who is a biologist. There is Lina Fusaro, who is a plant physiologist. And there are so many people. And we are trying to look at the big picture. Here, the big picture in my eyes is the reactive oxygen species and the inflammation, which is something that is very important in the atmospheric science because air pollution produces reactive oxygen species, oxidative stress, in also particles, pollutants, but also in humans, and inflammation. And this is where we are trying to produce markers, biomarkers, measuring this. This is a paper just published where we try to give our view of urban health. So connecting the dots in the planetary health perspective, putting together urban air pollution with a new vision, urban climate with a new vision, humans with a new vision, cohorts and cells with no animals, and also plants, the urban forest. The focus is on urban. What we try to do is producing evidences. You see here on the x-axis what we measure as the cause of what we see in response in humans and plants. Just one message I want to give you here. We, as an atmospheric scientist, we go beyond PM10 and PM2.5. This is the first message. Please consider that air pollutants are millions and millions of molecules, including reactive oxygen species. Health. Anna Maria looked at the microbiota. We have looked at the salivary samples and microRNA and gene expression patterns there. We also use in vitro cell exposure to measure the same parameters and then control the conditions. And we also measure all of this in plants, because also plants can be intoxicated by what we produce. Very quickly, the results. So we consider not just the very polluted conditions that are in our urban areas in the high-income countries less and less common. We now consider the clean atmosphere where traffic emissions are there. And please trust me, being in a very clean atmosphere in an urban areas with cars can be more dangerous than being with a very, very hazy conditions, because there are a lot of reactive oxygen species available. Point one of the results, gene expression patterns and microRNA. We have found, and this is also under review in a paper, that after 5 minutes of exposure, 5 minutes, in the human body, you have a very intensive response, biological response, that then after hours and days become an inflammation response. But we have measured after 5 minutes this in vitro cells, but also in humans. Second point, and Anna Maria is here, the human microbiota. You see here in the x-axis, the gradient from rural to urban areas, and in the y-axis, an indicator of biodiversity in the microbiota. You see there is a gradient. Healthy people living in rural areas experience a very better condition of the microbiota, just because they live in rural area as compared to urban areas. And finally, because I just have 5 minutes, plants. These are fluorescence and reflectance measurements of plants in Villada in Rome. And I will not explain the details, but the paper is published. The more you are close to the trophic source, the more the plants get oxidatively stressed. So the toxicity that we see in humans is also in the plants, and this is measured. So just one solution I want to give you. Fossil fuels are the major cause, and they are threatening planetary health.
No, yes, we finished. No, we finished.
Say, you're finished?
No, yes, I was here just to support Francesca, but
this
was our work.
We are trying to demonstrate that this is a teamwork.
No.
It's a very large team.
Thank you very much. No, I experienced Francesca in a potential European project. I can tell you, he's pushy, enthusiastic. So work with Francesca and yourself also. Okay, Anna Maria. Thank you. Go ahead. So, if we have ready for Casimiro, I don't know if we have ready. If not, okay. So Casimiro is the next one. Casimiro works in UNESCO, and he's been many years working in the African European Foundation. So, this is for the moving, and this is...
Thank you very much. So we're going to switch from something very technical, and it's extremely interesting, the information, the technical information, to a more policy point of view from a UNESCO point of view. Okay. Just to say that, like, I work in the natural science sector of UNESCO, and I will explain why we are here and from which angle. If the presentation starts, don't worry. To remind that people sometimes ask why UNESCO is involved, because it's known mostly for the cultural heritage and maybe education, but nobody knows that the S of UNESCO means science, and UNESCO has been involved in science since the inception in the 40s. Here we are. The science sector, the natural science sector in UNESCO has 3 divisions. One is science policy and capacity building, where I work. Then there is the EES, ecological and earth sciences, and the water division that works on water and all the different aspects of water. And there is also inside UNESCO the IOC, the International Intergovernmental Oceanographic Commission, that is an independent agency that depends also from UNESCO. So I'm actually currently being the responsible officer for the Human Cell Atlas. The Human Cell Atlas is an initiative started in 2016 at the Broad Institute to create a consortium for the mapping of the different cells functioning and down. Yeah. No. Yeah, here we are. Yes. So the effort to map all the human cell types. When UNESCO was involved in the Human Genome Project from the 90s, and there is a long history of supporting scientific effort, especially in sharing open data in life sciences. The mission of the Human Cell Atlas is to create a comprehensive reference maps of as a basis for advancing biomedical research research, understanding the fundamental cellular process, and also to bring to new approaches in diagnostic and therapeutics. The consortium is composed by more than 500 researchers or groups all around the world in 104 countries, and 18 biological networks. The networks are organized in tissues and organs, and also regional networks. It's an open access platform. This is linked with us, with UNESCO. As you know, UNESCO published the recommendation on open science. And it's also integrated in the science diplomacy, as we strongly believe in UNESCO that the use of scientific data is a powerful tool of science of diplomacy. This was done with the Genome Project, was done with the Human Variant Project in the past, and now with the Human Cell Atlas. So these are, I don't want to go into the details because we have no time, but there are a lot of insights into cellular diversity, the function, the development, in order to understand disease and at a cellular level. The applications are, of course, diverse in cancer, biology, in immunology, regenerative medicine, in neurosciences, and we will go to our common link with One Health. I'm gonna shorten. The goal is to catalyze new therapies, diagnostics, and precision medicine. So we are part of the role of science diplomacy and open science that I already mentioned. I will be very short. The important link is that we are doing through UNESCO with the Exposome Moonshot program. That is an initiative created in the US through the Columbia University, Johns Hopkins University, with a big support back in in May 2025, so a few months ago, of the National Institutes for Environmental Health Sciences, and the idea is to link the Exposome Moonshot program with the Human Cell Atlas in a One Health perspective, in which we can understand the effects of the exposome into the human functioning, in the human cell functioning. We are going to organize a workshop together between the two projects before the end of the year through the UNESCO network. We work closely with different programs, as I mentioned, in UNESCO, but specifically with our field offices in regional hubs, with the Category 2 centers in biotechnology, and also with the chairs, UNESCO chairs related to life sciences. It is important to say that the Human Cell Atlas is framed within the International Decade of Science for Sustainable Development that has been declared by the UN and managed by UNESCO, where my division, my sector is the responsible secretariat. Of course, the principles of why the project is included and framed in this decade is for reducing global disparities in research participation, building inclusive infrastructure for open data and collaboration, and strengthening the science policy interface in biomedicine and One Health in the case of 1 minute. In the case of the interaction with the exposome, I finished just to say it's very important for us, especially in this kind of research, as from a UN point of view and UNESCO point of view. Africa is a global priority of the organization. And we know that this kind of endeavors, scientific endeavors, are often very Western driven. So we want to push and create capacities in the so-called global South. I don't like this expression, but with a priority for Africa. Thank you. I try to be clear.
No, thank you very much. And thank you very much. I take advantage just to comment that each of you, with the banner I show you initially with your photo, will make a summary of 5 bullet points of each of your talks. Okay, I think it's very important. Not you, for example, in your case, exposome, UNESCO objective, final next steps or potential, because this is very important. No? For example, Jesus will speak later. He connects philanthropies with investors, with people. So these kind of projects are the ones that can be connected. No, I think it's very important. And congratulations, Casimiro. Thank you very much. So now we have Alessandro, super young star. Come on. And please, Marta, be prepared later.
Try to launch my timer so I'm in time.
Go ahead.
just to make sure of that. Okay, I have some slides. I hope I will be in time. And I don't remember much without the slides, so 3, 2. No, by the way, I'm Alessandro Berioni. I'm the chair of the Young World Federation of Public Health Association, which is a working group inside the World Federation. It's like umbrella organization with all the national public health association. I am Italian, but I try to disguise my accent, which is not happening, but okay, that's it. This is the slide to present the World Federation. We are like an NGO that's based in Geneva, and it's mostly focusing on global public health advocacy. We have more than 130 members across the world and representing more than 5 million public health professionals. And we're trying to make more youngster people come inside the World Federation and increase and amplify the words of younger people, early career professionals, as we were discussing also before. So our group has mostly the vision of empowering, engaging, aggregating students worldwide, either from different environments. So as we have been discussing the whole day long, I like the words of health in all workforces. So having health inside the public health, inside of the medical, inside of medicine, inside of atmospheric science, whatever. I mean, health is everywhere, and this is something we need to spread, and we're trying to spread these messages all over the world, especially in young people and also across different countries. The goal for us is promoting opportunities, empower public health, early career professionals worldwide, and facilitating exchange of knowledge, either different countries and different topics and disciplines. This is our membership, more than 80 countries and more than 1,000 members for our group of young WFPHA. We are running several research activities just for show you like what are the challenges that early career professionals face, the public health manifesto for how to increase the training. And we do work a lot on mostly digital health, AI. We just published a commentary on generative AI and misinformation. I don't have the link here, but I can share later if anyone is interested. But just to say that we're working a lot on research, education. We always run lots of webinars, Congress, and this is the next one that is going to happen in South Africa. So September 26th. Glad if you want to join, or actually would like to discuss with any of you any potential collaboration. And I will go very quickly with some innovation comments. So just a very a quick insight of what we are trying to bring with the Young WFHA as a connection between innovation and public health. So this is some collaboration and projects we've been running, either UNGA, last year we've been for the AMR, this year we had some delegates there as well, and some other collaboration with the Council of Europe, Digital Transformation for Health Lab, Youth Health Organization, and so on digital citizenship. Very interesting topic, but no time enough now. Just to say that we are trying to strengthen the innovation ecosystem, finding a way to enhance bottom-up innovation, so supporting public health professionals to raise up their ideas, and we just create the platform and the playground to support them and make them become like structured ideas that can actually thrive. Just to say that we would like to launch in a very few months a public health innovation lab that we have been discussing quickly before, so just to show you some more details. And so we would like to have this platform where people and public health professionals can propose their ideas, and we can support, as I was saying, either people that can be youth, expert, policymakers, and communities, so we can manage to actually drive and address the public health challenges locally. Oh, this is going up. I need to go down. So the first focus we would like to focus on is like AI-powered social innovation, how to fix this type of social issues through AI. And we had like a challenge that we wanted to launch. I know that I have only 1 minute left. This is a book I like a lot. One? Okay. Just to say that one of the first topic we would like to address is how to make AI and algorithms more value-driven and value-focused rather than just focus on the engagement. As you know, most of TikTok, Instagram, just focus on the time you scroll on the platforms. But why can't we make these algorithms, the AI, more focused on the values that could be like learning, education, and what's on? So we are trying to, let's say, ignite and trigger our community to make this happen, and we are planning to have an hackathon in the very next months. We have had some delays with the UNGA, World Health Summit, and so on, but this is still in the plans, just to share what we'd like to do in the innovation side. So just 3 take-home messages for us. Youth needs to be at the forefront for their fresh perspective and way that they want to approach things. Innovation in public health is a key component that we're trying to, again, highlight. And we need to have a renewed digital social contract to have more altogether discussion how also these active communication tools like AI can be combined and be part of our daily life. again, QR code if you want to take part, or if you want to apply for any type of session workshop. The deadline for the session is 30th of November, so feel free to join, propose, or reach me out. I'm happy to discuss together how we can do that. That's it.
Who said that public health was boring? No, it's not. No, it's not boring. Yeah, yeah. No, congratulations. We need this youth power. So thank you very much. Thank you, Alessandro. Push, push. You have a lot of work with these politicians. Go, go. Marta, thank you very much. She's our host. We thank her a lot. Thank you very much, Marta.
Thank you so much, Jordi. Well, I will try, after Alessandro, to be very fast. Okay, sure. Since I got an extra minute, I will just start to say that actually I am a biologist by training, but I used to work with infection disease. So I consider myself a kind of hybrid person, so I share myself within like Italy and Brazil, where I used to work with the Osvaldo Cruz Foundation, as well as the Pan American Health Organization. So I will just try to share with you a kind of a novel approach for a study of infection diseases that will merge, let's say, experimental virology as well as the use of artificial intelligence and eco-epidemiological modeling, not just to, monitor the real-time evolution of pathogens, but also try to detect a region at risk of transmission. So this actually started, let me see, it's not working. Okay, so one of the main things and the huge warning is of course related to the fact that climate change has the potential to aggravate over 50% of human diseases and pathogens. So one of the main points, this means that actually of course we are not just following more often epidemics, but also we are also following the emergence of new pathogens that's supposed to be able to spread into novel regions, and pathogens that are supposed to be able to adapt into novel hosts and vectors. So one of the main things, it will be try to understand the drivers behind emergence and reemergence, but even like expansions. So this is supposed to be like rising temperatures. We're supposed to be able to boost mosquito spreads, and then of course create some specific mosquito breeding grounds. And this means that actually we will have novel regions at risk of transmission. So an example of this is of course this kind of sustained transmission of dengue and chikungunya, even like in Europe as well as in North America. So but temperature is not the only drivers. We also have extreme events, including, for example, floods, storms, droughts, that might, of course, fuel novel outbreaks through, for example, contaminated water, and we might have more epidemics. Also, this is supposed to be linked with displacement, crowded, that's supposed to enhance disease spread. And an example of this is, of course, the 7 cholera epidemic with repeated deadly outbreaks. So this is just to share with you what I am working on, this kind of novel genomics framework in order to try to, put in place active strategies in order to try to monitor the real-time evolution of these pathogens, which will merge different kind of data, including environmental, evolutionary, and epidemiological one. So we start to use this in Brazil during the emergence of Zika. One of the main points at that time, it was like try to unveil the pathogenetic aspect associated with the infection caused by this virus, including, of course, the fact that the virus was able to be associated with differential clinical outcomes, including microcephaly. So we, but of course, it's appeared to be also important, like try to understand the drivers behind and associated also with this kind of exacerbated human activities. Our call for actions is actually like try to put in place a kind of novel ecosystem. So this was why actually we implemented the Climate Consortium. So the Climate is a kind of global initiative in which we used to collaborate with PAHO, WHO, as well as with the African CDC. So we aim to try to study disease that might be amplified by climate change by working on 3 different topics that's supposed to be ecology, epidemiology, and understand evolution, and at 3 different levels. So we used to develop novel approaches using next generation sequencing in order to try to unveil the entire coding region of some specific pathogens, emerging one. We do use then also vector competence studies in order to try to understand the vector competence and in order to try to perform assess the performance of pathogens and the interaction with the human host. And then we do use to extend some of these activities of artificial intelligence. So this is the likely integrated modeling framework that we are trying to perform, which used to merge different kind of data and models, including phylogenomics, epidemiological, ecological ones. So this might allow us to perform this kind of genomics epidemiology plus. So we aim to try to understand the transmission dynamics, the effect of climate change, try to predict and forecast epidemics. And this is a kind of general structure of what we start to perform. And this is some projection that actually we put in place. So in this work, actually, we try to estimate the climate-driven transmission potential for mosquito-borne pathogens in order to try to point out in the global south some specific blind spot, region at risk of transmission. And the same we did in Italy in order to try to understand the main drivers behind the emergence and this kind of sustained transmission of dengue. So we point out at the presence of 2 specific clusters, and then we try to forecast this kind of challenging climatic scenario in order to try to understand how, of course, climate change played an important role in the expansion of these pathogens also in our region. So just a few take-home message. Climate change is, of course, reshaping host-virus vector interaction. Vector competence might clarify how pathogens adapt and spread. Genomics, serology, and AI might reveal hidden path in transmission. Integrating collaborative approach might enhance preparedness for emerging pathogens. Thank you.
Thank you, Marta. Good work, a lot of good work. We hope. No, it's good work. We hope that the ministers of health of many countries, can really have your forecast into account. Thank you very much. Thank you very much. So now we have Gabriela. Go ahead, Gabriela. And thank you for coming from San Diego.
Thank you for having me. All right, so we can go ahead and start. So first, I'm Dr. Gabriela Fernandez. I'm director of the Metabolism of Cities Living Lab. We're located in San Diego, California, and I'm going to talk a little bit about AI and the One Health approach and how it is all connected. All right, so now more than ever, we have big data access to our fingertips. And I think that this is a great time to be alive because now more than ever, we have access to people that we never had data on, right? So we're going to talk a little bit more about these different vulnerable groups and how we can utilize data as a way to make sure no one is left behind. As part of our lab, we work on several different activities from creating awareness more on the social, environmental, and economic aspects. We also have created exhibitions focusing always on advocating for the SDGs, vulnerable communities. One of our projects that we're currently working on is understanding homelessness. And I'm going to talk more about particularly homelessness in the US as well as San Diego, California. This is a National Science Foundation project that I'm currently working on. And so we're trying to have a better understanding of homelessness, understand how AI can be utilized in order to detect homelessness, and also develop a network of consortium. So if you are not aware, in the United States, we have over 600,000 homeless people across. Half of those, more than half of 600,000 are located in California. This is completely unacceptable, and with 10,000 in San Diego, California. So what we're utilizing now is AI in order to detect homeless encampments. In addition, we're also building a network in order to gain consensus and also let's say, more support from local governments and different nonprofit organizations that are working to alleviate some of these different challenges. So as of now, we do see the homelessness that are happening across the US, but do we actually know about the people and their storytelling? So in addition to identifying homeless encampments, which I will talk more about using AI, we're also trying to understand and developing surveys in order to share and also create more empathy across the US, which is something that we really need currently. So along with some other researchers and students, I teach in the master's program in big data analytics. We're utilizing AI and different machine learning methods in order to identify homeless encampments. As you know, this is such a large issue that is currently happening across the US, and with the use of AI and understanding that certain surveys become outdated quickly, utilizing data that is currently available as a way to have a better understanding of the current situation. So some of our objectives is to develop robust deep learning models, evaluate our programs and our models as well. I'll quickly go over this. So we have collected over 1,430 Google Street images in order to identify homeless encampments across. This is quite time consuming, but as of now, we're still focusing on training our models in order to help us make our models stronger. Additionally, we wanted to also test to see what other kind of items we can detect from our Google Street images, besides encampments, also cars, carts, as well as people and bicycles. We understood the ethical, let's say, implications regarding identifying specific people, so we decided to focus mostly on the encampment situation. Some of our data sets, this was a manual work, so we downloaded Google Street images manually, but definitely there's still room for improvement. Here you can see that we utilize DeepLab v3 in order to train our models. Some technical aspects that here you can see some examples where we use mosaic augmentation as well as mix-up augmentation in order to identify the homeless encampments. Additionally, we wanted to test the different scenarios. We had the highest scores identifying homeless encampments using Google Street images. We decided to develop several different scenarios using different types of machine learning algorithms. And here you can see always encampments as being the highest and the most strongest. Here you can see the way that we use some of our Google Street images, but also you can see the differences in how the programs are successful. I want to skip to our next example regarding AI. Oh, additionally, we're having a hackathon this November. The idea is to bring high school students, community college, universities for students to develop projects regarding homeless solution using big data analytics. So just mentioning that as another way to gain more understanding of the public. Another project that we're working on is using identifying microplastics using AI. We're working with the university in Sousse, Tunisia. We have collected over 1,000 images of different types of plastic. The idea is to understand which type of models are more efficient compared to others. We've used CellPost, we use V8, and as well as CellPost and SAM. And so as of now, this is an ongoing project that we're working on in order to detect what is the most efficient machine learning model. Another project that we're working on in terms of AI is to identify diseases in plants. So as of now, we are looking at cashew, cassava, maize, tomato, several different types of crops. This is data from Central Africa. The idea is to work closely with farmers as a way to help them detect diseases within their plants. So identifying plant diseases in time based on location. Right now, we're working with this data data set, but we hope to definitely expand to other different types of locations. And again, this type of research, it's very much ongoing. Data is constantly changing, and the idea is to prepare our models, train our models, and make sure that ethical considerations are also included. And just basically the next steps is just to make sure that, when we think of AI in One Health, to make sure that we are also thinking holistic and data-driven solutions. Additionally, making sure that we expand our data set. We look at different scales and we refine our models. And that is something that we're currently working on with our university and our students. So thank you very much for your time.
So thank you very much. Lorenzo, be prepared. I don't know where yeah. So it's your turn. Thank you. No, thank you, Gabriela. It's impressive. No, don't worry. Thank you, Gabriela. Impressive. 600,000 people in the street, so a lot of work to do. Thank you very much. Thank you very much. Lorenzo, your turn.
Thank you. Remote?
Yeah, it's there.
Yeah, so in the meantime, I'm going to introduce myself. I'm Lorenzo Gianquintieri from the Politecnico di Milano, and I am a biomedical engineer, so one of my goals will be to try and make you understand why a biomedical engineer is here talking about planet health, which is something kind of unusual in our sector. To do that, I'm going, if the remote works, okay, I'm going to start from this very simple concept. So traditionally, in medicine, what we have is an healthy person against a patient. And there is a very clear threshold. There is a diagnosis. So you have a diagnosis, then you are treated, you are a patient. Otherwise, you are an healthy person. But if we think about public health, so the health of a whole population, this paradigm doesn't stand anymore. So we should start thinking about health as a spectrum rather than a binary condition. That's our belief, and that's why at the DIGA lab at the Politecnico di Milano, we started this research line, which I am currently leading in health geomatics, which requires clearly an interdisciplinary approach. So basically, we start from georeference data. We try to apply some predictive modeling within geographic information systems. So there is all this part about spatial data, trying to develop some maps for territorial risk. And why that? And I want to point your attention towards the final goal, which is provide evidence-based support for public policymakers. That's our goal. So for example, let's talk about environmental epidemiology. And I'm not talking about vector-borne diseases, but in this case, I'm talking about non-communicable diseases as generated by the climate stress. For example, let's consider heat or heat waves. So that's our environmental stressor. Now, the pathophysiology is well known. We all know how the heat is impacting the human biology. What is less known is how this impacts on an ecological level. So on a whole territory and on a whole population. This requires a different perspective. For example, in Italy in 2022, and this is published on Nature Medicine, so it's kind of reliable, we had 18,000 excess deaths due to heat. So excess death. How do we get there? That's the state of art. The distributed lag nonlinear model really has become the gold standard in this sector. I'm, of course, not going to explain all these charts, which we developed as a research group, but just to give you an idea, think that each and every one of these constituting blocks has some kind of quite consistent and strong mathematics behind it. So you can understand that, yes, this is very robust from a statistical point of view. It is accurate because it is modeling everything mathematically, and it is the gold standard. It is widely adopted and validated. But it relies on assumptions that are kind of strong. It's heavy on a computational point of view, and it's not so interpretable. So it can be used to isolate the attributable fraction of risk towards an environmental stress, but it cannot be used to rank what are the actionable drivers to adapt against this stress. And also to study the spatiotemporal variability, because it is too heavy. So that's the problem. We felt the need to develop something different. I will try to show you what we did, but first, just a couple of words about data. So we need public health data. Our opportunity in environmental epidemiology is to work with the regional provider of emergency medical services. This allows us to have data that are very granular from a spatiotemporal point of view. Of course, we do not have official diagnosis because they are not hospital data. We have to rely on the classification that is performed by the paramedics, but still, we have a lot of data with exact timing and exact position because we have the coordinates. So we can study really the short-term effect of an environmental stressor. From the environmental point of view, once again, we need very high spatial temporal granularity. The traditional approach is based on ground stations, but they are discrete points, so they need interpolation, and on top of that, the distribution is uneven. So that's why we moved toward Earth observation data. By collaborating with the European Space Agency, we are relying more and more on satellite imagery in order to have this kind of environmental measure. So health data, environmental data. Now, what we do is to develop this new index that allows to stratify the risk across a territory. It is a purely statistical model. It is based on the comparison with statistical testing of bootstrapped data in exposed against non-exposed days. With some kind of sensitivity analysis, we can also identify the correct lag and the exposure threshold. Now, what are the strengths of this model and why did we need to develop it? First of all, it is highly flexible. So you are seeing here an example which is cardiovascular health related to heat in districts across a region. But the exact same model can be applied to study, for example, air pollution and its impact on respiratory health, for example, in districts of a city. So really, with the same statistical structure, we can compare different environmental stressors and the exposure-response relationship with many different medical outcomes. The other strength is that it is highly interpretable. It is a simple index between -1 and 1. And why did we need that? Because we can use this index as the input for a further stage of explainable geospatial artificial intelligence algorithm. This is published. Long story short, first step is just to select the features and avoid collinearity. The second step is some kind of enhancement of the geospatial component. So in that way, we can really make emerge the very local phenomena and the very local relationship. Finally, we have a random forest, which is a very simple machine learning algorithm, which is interpreted with the Shapley additive distribution algorithm. So this is an explainable artificial intelligence algorithm, which allows to open the black box of the machine learning engine and see how the model is interpreting the different variables that we have included in the model, allowing us to rank them by importance. So this can help in identifying actionable drivers towards adaptation, which, if you remember, was our initial goal. I know it was quite technical, and within 5 minutes, maybe not so easy, but I tried my best. So thank you for your attention.
Well, thank you, Lorenzo. I think it's important to make understand politicians that AI is not ChatGPT. No, I mean it's a machine learning, CNNs, many other things. Congratulations. So with that, we have now Jesus. Thank you, Jesus, for being here. Jesus Colina is a fantastic person, journalist during the last 30 years around the Vatican and many other places, and he's now working with Bodato. Please, Jesus, go ahead.
Thank you. So we have all here a huge challenge. How to improve people's well-being and planetary health with innovation, through innovation. But innovation, by its very nature, requires investments, huge investments. Who will take on these investments? The public system is already overwhelmed by the daily life, by the health system and the educational system. The market, for the market is complicated sometimes. They want and they need urgent benefits. And sometimes here we are thinking in years and in long future. But there is a third pillar, which is philanthropy. But we are talking here about philanthropic innovation. What is philanthropic innovation? At Vadato, which is an innovative fundraising agency launched here in Europe, we connect major donors with non-profit organizations with new tools. We are creating the new philanthropists. For example, we offer solutions of philanthropic finance. We create sharing funds. It means funds that combine the profits between the investors and the social causes, the ONGs. For example, we advocate for the development of philanthropy among potential philanthropists. We do lobbying, we do network with all the big fortunes in the world. We use artificial intelligence to serve social causes. We present solutions such as enabled donations through cryptocurrency. We help the ONGs to convert donations in real estate, in copyrights, in art, on social causes. We bring digital opportunities for our cause, especially through growth hacking. And we offer solutions to promote a better management and greater transparency of the non-profit organizations. So we try to redefine philanthropy in the fourth revolution, which is the digital revolution. And this digital revolution can create the new philanthropists. Thank you.
Thank you. The Vadato, it's a French company. Yeah.
That is growing in Europe, Switzerland, and now we are starting in Italy.
Yeah. As you can see, he's starting now, and it's very important because the ethical threshold of this company is very high. So to choose you, it's because I know you very well. I understand why they choose you, so congratulations. And I think you already have contact with Campus Biomedico and other clients in Italy.
We are working with them.
We're working with them. So Jesus, go ahead. Thank you. Thank you very much. Thank you, Jesus. Yeah. So sorry because we are so many and I forgot who is coming now. So Jordi, do you know it? Moment. So, okay. Yes. We have Sanita. Thank you. The name, it says all. Medicine without cruelty. So please show us.
Thank you very much. Hi, everyone. It's a pleasure to be here. My name is Savita, and I'm a program leader for a higher education institution. I'm a trained clinical scientist, and in 2023, I set up an educational non-profit called Medicine Without Cruelty. And our mission is urgent and it's clear: to end the use of animals across all sectors in science and to educate students of all ages in modern animal-free techniques. So every year, 115 to 200 million animals are used in experiments. That's not science, that's mass suffering. And the narrative has always been that it's necessary for scientific progress, but the evidence against this is overwhelming and undeniable. 95% of drugs fail after they pass animal tests. And there are clear historical failures, such as Vioxx and TGN 1412, where it was safe in animals across multiple species and at a fraction of the dose, that then led on to severe harm or even death in humans. Drug metabolism varies across species, as we know, but they vary even within a species. For example, the genes encoding liver enzymes in greyhounds are so unique that you can't even extrapolate that to, say, another breed of dog, a Labrador, for example, let alone a completely different species. And so what's the solution? Why haven't we ended this immediately? That begs the question. So our solution with Medicine Without Cruelty is simple. It's a three-pronged approach. We want to educate students of all ages, starting from a young age, to inspire and to create science lessons that are inspiring and also without harming animals. And this goes way beyond the simple replacement of dissections. Of course, that is very important, to replace dissections. We want to innovate by connecting and collaborating and mainstreaming animal-free innovations. A lot of you in this room today, you're talking about animal-free innovation across your sector in science. And we do that mainly from our online program. We want to create that platform to create this content for you. And we want to prepare students so that they can graduate and join the workforce in today's science, which is modern, which is animal-free. So how do we do that? So this is the available educational programs that we have today. The scope is building. So I mentioned about our online platform, and that's the Stop and Use Non-Animal Methods project, otherwise known as the SUN project. We create accessible and engaging bite-sized content of very complex topics. The topics you've all spoken about today, imagine trying to explain bioinformatics to a lay audience. But that is so important. Science communication should not be underestimated. It is that lay public who might even fund your research. It is that lay public who might influence key decision makers. So we want to provide that platform and make it freely accessible. And we want to collaborate with animal-free companies, so please do tell me if you want to get involved. For schools, as I mentioned, we want to embed both ethics and modern science, but again, make it accessible to the classroom age. And build on animal-free methods, student worksheets, and we want to work with specific schools to provide bespoke support. We want to embed it in your curriculum and create that cruelty-free ethos right from the very beginning. For colleges, for some students, that may be the end of their educational career, and so we want to make sure that they leave college with accredited modules. So we've already designed an introduction to non-animal methods, and we've got a diploma in development, and it's been accredited with a UK-based awarding body. For universities, we have ready-to-teach foundation and level 4 modules. We can provide guest lectures, and I wanted to just explain this last bit. We want to establish champions within your university that will effectively guide cruelty-free research. It will make effective use of research funding and oversee ethics and oversee animal-free innovation. And finally, I want to just tell you why that's so important. I mean, universities, they teach today's science. They set the standard for modern science. And they hold a moral duty to make sure that the science they teach is rigorous, scientifically rigorous, and free from animal cruelty. By prolonging animal testing within your institution, you are clinging to outdated, unreliable, and unethical practices. And as recipients of public funding, they are accountable for how effective they use that research funding. And students and society today, and taxpayers, they expect modern, cutting-edge innovation. So I'll leave that with you. This is kind of our call to action. We want to pilot Medicine Without Cruelty units, modules in your institutions. Please do invite me for guest lectures and seminars, and we can work on how we can embed these modules into your existing curriculum. We want to collaborate with animal-free companies and research labs. And finally, we want to work across all disciplines, because everything we talked about today, I mean, it's all different disciplines here, but we're all talking about animal-free innovations. So let's adopt modern animal-free science and education today. So thank you very much. And my last point, no more phase-outs, no more delays in ending animal testing. End it now for animal and human life. Thank you.
Bravo. I think it's important. You are in Università Campus Biomèdico. Tomorrow you can also contact them, and it's always important to start with the medical school students, because it happened the same with digital health. They had no curricula in there. Maybe you could go there. That'd be fantastic. Thank you. So Lars, thank you very much. Lars has come from Denmark. We appreciate that a lot, and we're so sorry we have not so many minutes, but thank you very much. Thank you, Lars.
I'll try to use the minutes that I get as best possible. And I have about 1,000 stories that I wanted to tell you, but I'll limit myself to only one. In this context, we're talking about AMR and the work that we've been doing in the European Health Futures Forum on antimicrobial resistance. And there's a second to go before the slides are there. The European Health Futures Forum is a member organization of about 120 or so experts working across different arenas for health futures, not healthcare futures, but health futures. In that, what we've been looking at also in the EHFF AMR Action Group is to see how we might use different kinds of creative approaches on trying to do something about. Creative approaches in this context, I pressed the wrong button, the wrong one, yeah. Oh yeah, cool. So stronger data for targeted actions for citizens, the creative campaigning to engage the citizens, and policies to actually then increase the AMR health literacy, thinking that in this particular case, the only solution we really have is to crowdsource the solutions. We have 6 billion citizens. If we wait to do something about figuring out what to do about antibiotics until they're actually at the GP office, we've lost the battle. So it's about taking the sort of the initiative to the streets, as it were, to try to do something about raising their awareness. One problem then is because, okay, so fine, you want to do something about targeting those citizens, but who, where? We have to build a map. So one of them is to then figure out how to build a heat map for community action. The idea is, of course, in that to be able to have better populations that are able to actually act upon that. We have a couple of instances where you can definitely see when you try to raise the antibiotic awareness, you get a significant output almost instantaneously of a reduction in the use of their antibiotics by about 50%, because nobody really wants the side effects of the antibiotics. It is not a wonder drug. It is a drug, yes, and like other drugs, it has side effects. As long as they don't know what those side effects are, how could they possibly choose alternatives, whatever they might be? So On the creative side is, of course, one is to, for instance, in institutions. Most of you that have been in a hospital notice that they currently use a thing called computers. These computers have screens. They have screensavers. What are those screensavers doing? Nothing. So, how about using that empty space for something like creative messaging? 365 animations, that gives you a year of campaigning. It doesn't require anything in terms of, more or less nothing, in terms of adapting it to different languages, and then you have a national campaign. If you believe in the value of antibiotic stewardship, this is a way to go. The same, of course, applies for open-air campaigning. Different kinds of open-air ad agencies are willing to also do something to build for the common good, but someone has to build the messaging for them that engages the people. Is this something people care about? Yeah, they care about their health. Do they care about their children? Yeah, they do. And it's sad that we only see children at these conferences so rarely, so kudos to you for taking two, actually, with you. So trying to use this creatively, and of course you can do this fairly cheap in terms of developing the graphical model, but boom, you have it working in every hospital in principle across Europe. So the trick with the people in general is who needs to know something. So generating a heat map. How do you build a heat map when you have piss poor data quality? Well, one of the cases that you could use is going into the fish industry, where they have underwater robots that are able to actually detect the different elements that are in sewage water. Think about the number of underwater robots you then need to get to at least have a decent idea which cities are using high amounts of antibiotics and who has the resistant strains. Will it work to communicate to people that don't care about whether they have a problem? No, it will not. Will it help to communicate to people that you can identify that they have a problem? Yes, it will. And then, by engaging these underwater robots, you would have real-time data to actually give you a fighting chance of figuring out where the enemy, in this case, would be. And whether you define enemy as ignorance or maybe a lack of willingness, that's up to you. What we then also did to go from ideation to creation is to figure out how can we use gamification to fight this issue. Currently across the EU, there is not a single country, repeat, not a single country that are using a gamification approach when it comes to AMR. Have you noticed anyone of yourselves, or for that matter, younger generations that are using games? Yes, it is something that they really want to spend time on. Can we possibly use this platform to give them just a tidbit of information? Yes, of course we can, if we build the right games. So in this case, what we were thinking is that we have wonderful game developers in, for instance, in Africa. How about we link them up to get them at least a fighting chance to get them a market in Europe, a European school, because we have a sort of a market for knowledge when it comes to using these elements. And combining them with a joint platform that generates a market for these game developers and, of course, to fit the need that we have across the different countries in Europe. And this is the list of the different places where I'm trying to push this wonderful message. And now you also got it. Thank you. I was quick?
Yeah. No, I was talking with, thank you, with Domenico, by the way. Lars, thank you very much. Thank you very much. I think it's very interesting, your approach, gamification and importance of antibiotic resistance. We have a lot of work to do. I was talking with Domenico, you know that he's the organizer of the One Health tomorrow, okay? And how difficult is the organization of this conference, no? This is a different approach, not worse, not better, but different. So thank you, Lars, thank you. I think some of you that have these projects with industry could really have a link with Lars, because there's a lot of ways to approach these different industries, municipalities, and how to change the behavior, which is the most complicated in that sense. Thank you again. So we have with us Carmen. Carmen, please come here. And we will allow Carmen maybe 1 or 2 minutes extra because of her English, but she's doing a big effort and we appreciate that. No worries, Carmen. Nobody here speaks new languages very quickly. Go ahead, no problem.
Tienes que apretar aquí, apretar abajo si quieres.
Like you see, I'm a family doctor, a clinical family doctor. I work by Catalan Public Health Service 30 years ago. I'm expert in environmental medicine and I am the president of the Catalan Society of Environmental Health, SOCSA. Why was SOCSA born? At the moment we have a huge amount of science evidence about how do environmental factors impact on the human health. But really we need to transfer this knowledge to healthcare professionals as well as to the community. Well, SOCSA was born in 2022. After 3 years, has experienced exponential growth. SOCSA was accepted as a multidisciplinary scientific society by the Academy of Medical Sciences of Catalonia and Balearic Islands. It was not easy. Our main objective is train professionals and communities to recognize and reduce environmental risks, getting to focus on the national public health system. That's our difference. Following the WHO guidance on the health and environmental, and due to the complexity of the exposome, SOCSA is organized in different work groups, like you can see, brings together professionals linking to environmental health, grouped by different areas, interconnected, and promoting collaboration between societies, universities, companies, institutions, and research centers. By that way, joining efforts to achieve maximum effectiveness by updated and quality scientific and technical development, regulated, accredited, and transversal training, community outreach across all sectors, and expert advice. Our strategy is leadership from public health systems and interinstitutional network, university, professional college, network training references of primary and community care, of hospitals, universities, city councils, training deployment across all areas that need different priorities order. The first, professional health areas, and the second, not health professional areas, and the third, community by nursing and community schools reference, and with community leaders. How we do it, how the SOCSA do it, We have different accredited training activities, but the most requested courses are this app. To raise awareness about recruiting leaders is for healthcare professionals. The first, introducing course of environmental medicine and central sensitization syndromes, 5 hours. And for the community is the toxic detection workshop at the home, 5 hours too. And the top level course as clinical course of environmental medicine, inter-university course, 12 universities, 110 hours, all is accredited. For the community, all top is the project Aterrat, Community Education Schools. After 2 years of intensive implementation with promising results, SOCSA is now the reference for training in health and environmental medicine for the Catalan public health system. Deployment in training for professional and community outreach through the Almeria's University. SOCSA, as a part of the Catalan's Health and Environmental Strategic Plan team, proposes territorial community environmental health diagnosis, targeted intervention according to territory. Our next challenge is integrate to environmental medical history in the current clinical practice that in Catalonia is the pediatric clinical history in the national Catalan health public system. Integrate. Conclusion and next steps. To protect people, future generations, and the planet, SOCSA offers high quality, up-to-date, and accredited training programs. SOCSA works on adapting strategies to the size and the context of the territory, taking into account the importance of intersectorial and interdepartmental partnership, health, universities, education, and community. And SOCSA next steps are expanded areas of action with the aim of integrate environmental health and medicine as a pillar of international health training, territory, alliance, and training keys to the global health. Thank you.
Very good. No, very good, very good. Now it's more easier, but during years, this Family Doctor Association has been fighting, no, in a moment where governments look like this thing as a thing of just the environmentalists and so on. So I think it's very important to support these organizations. So with that, we have Patricia Ripoll now. We have a fighter for the rights of the patients. And thank you, Patricia, for coming. We were lucky to be in New York some days ago in the UN General Assembly. And I can tell you that it was a fantastic experience. And here we are. So thank you, Patricia.
Thank you very much. Okay, we haven't listened very good, but if just a few seconds of this made you comfortable, imagine living with this kind of sounds every day, every single day of your life. There are a lot of patients, there are a lot of people with neurodivergences that they are living like this every day. Last year, I showed you a dirty glass of water, and I asked you who would drink it, and nobody wanted. I understand. But we don't know why we keep up. But we keep breathing dirty air every day, outside and inside. We keep upsetting unbearable noises, harsh lashes, and invisible stressors that shape our health. But why? Because what is not seen, as I'm putting here, is not understood. And if it's not understood, it doesn't exist. At Fundación Visible, we started with air, with indoor air. And we start with indoor air quality with the Aireamos project. We measure continuously, the indoor air quality. We create a national standard. We create also children's tales, technical books, and we develop a COVID risk tool. We have published several papers, or multiple papers, we can say, on how invisible air impacts on health. But our mission goes beyond air. We work for a planet where we can all coexist. That's what we are aligned with the Planet Health Innovation Network, enhancing human health and planetary wellness through innovation, research, and collaboration. Air is not only the invisible factor. Think about light. Light is not just illumination. It regulates sleep, it impacts on anxiety, it affects recovery, and with our projects like EmoLight and Chronic Light, we show how light affects chronic patients and how overstimulation impacts in neurodivergent people. We call them the invisible stressors: air, light, noise, or temperature. The small asterisks that never appear in a diagnosis, but that define how people truly live. That is why we are creating the Asteriscos Guide, to make this invisible factor visible. And this is not only advocacy, this is measurable. This is real, and this is science. At Fundación Visible, we make the invisible visible, because health is not just medicine. It is everything around us. The air we breathe, the light we receive, the spaces we inhabit. We are the voice of change. The future of health innovation is to see and act upon what has always been invisible. I'm Patricia Ripoll, founder at Fundación Visible. Don't hesitate to contact me to make the future real. Thank you very much.
Congratulations. I live with you what you did during COVID with Aireamos. Fantastic work when nobody was believing on it. So congratulations. Keep doing. Thank you. So we have now Dennis Falson. Dennis Falson, we will find need some time to talk about him. But basically, what we could do maybe is to change to Jordi. We change to Melissa or no? Or we wait for Dennis? Change to Melissa. So Melissa, you can come now because it was the next one. So thank you, Melissa, for coming from Munich and talk about your fantastic project, microplastics. Thank you, Anna. At the end. Yeah. One moment. Start talking.
Thank you very much.
Thank you, everyone. Thanks for being here till this late. Thanks for hanging on. I would like to talk about the project that I started with the Technical University of Munich. It's on hold because, unfortunately, science needs funding, and we are going through a crisis of funding, unfortunately, for science. You are welcome to donate if you like. And it is about protecting life before birth. Is there life before birth? One would wonder. Yes, and it is when we start existing in our mother's womb. So why not protecting it and also protect the life of the life giver, the mother? And this is through the detection of microplastics in placenta. There you go. Yes. So the unseen presence, microplastics are present. We all have microplastics, whether you want it or not. We breathe them, we have them in our drinking water. And so we need to recognize that they are present, not just microplastics, but also nanoplastics that are widespread environmentally. And the thing is that this translocation of microplastics might be causing either right now hormonal disruptions, and in the future might cause even worse things. They have been linked with cancer cases, not in humans yet, but in fish that have an accumulation of microplastics in the ocean. One of these highly studied object was being observed in placentas. And for example, this study analyzed 62 placentas, and all of them were ranging approximately 790 micrograms per gram of tissue. This is worrying. I mean, we don't like to talk about plastic people, but we are becoming plastic people, unfortunately, without we want it or not. And the size matters this time, because the translocation capacity depends also on the physiochemical properties that they have, how they move in our bodies, how do they accumulate in our bodies. One might think, oh yes, we are able to eat them and then we release them in our feces. Wrong. They are bioaccumulative. So the documented adverse development outcomes have been observed in preterm birth, also in related to low birth weight with some babies, and it is being linked some types of microplastics with autism cases. It is 6 times more likely to receive an autism diagnosis for somebody who has been exposed to them, particularly from babies and kids. And in general, we don't want plastic in our bodies because of the toxicity that they generate, the reactive oxygen substances, the raw substances that they generate in our body. It's a danger in the future and in the present. So our current method that we are analyzing, it is Raman microspectroscopy. We place some tissue of the placentas and we analyze them, what kind of microplastics we have. Of course, microplastics are very varied, very often widespread, but we want to identify specifically which ones are the ones that are accumulating the most in the human body. And as we know which microplastics we are exposed to, then we know how to probably protect the mother, then we protect the product in the future. This has been the work cited, and I do not have results yet because the project, unfortunately, it's on hold. But I am looking forward to generate something for science and for health so we can develop preventive ways to go on with our lives without being fear of having cancer or any hormonal disruption disorders. And with that, I'd like to thank you.
Thank you. No, very good, Melissa. And we hope you find your funding. I think it's very important. Keep pushing. So if we have now ready the video of Dennis Falson, he's leading the tuberculosis innovation at WHO. So let's go for it.
Greetings from Geneva. My presentation will briefly describe how artificial...
Dennis is from Malta. I know him because 7 years ago already we were together working in AI and bots at that time.
Greetings from Geneva. My presentation will briefly describe how artificial intelligence is helping to address gaps in the detection of people with tuberculosis in the world. My name is Dennis Falson, and I work on tuberculosis with the World Health Organization. With about 1/4 of the global population having been infected with TB bacilli, the pool of individuals at risk of developing TB in the coming years remains huge. About 11 million people develop TB each year, and 1.3 million die of the disease, making Mycobacterium tuberculosis the single leading infectious cause of death worldwide. Moreover, about 400,000 persons develop multidrug or rifampicin-resistant TB each year, complicating their treatment. Global TB incidence was estimated to be on a slow but steady decline for several years until the onset of the COVID-19 pandemic, following which it started to rise. There remains an important gap between the estimated incidence of TB, shown in the blue line on this graphic, and the number of people actually reported to have been treated, shown by the black line. This is a result of challenges to detect people with TB, given that screening and diagnostic tools are generally poorly available in the populous, low-income countries where much of the TB burden is concentrated. The low coverage of appropriate diagnostics where they are needed most is also reflected in the low detection of drug-resistant tuberculosis. Less than 1/2 of people with rifampicin-resistant TB are estimated to be detected and placed on treatment each year. The good news is that state-of-the-art diagnostics have now come within the reach of patients, even in low-resource settings. Molecular diagnostics are being scaled up in many countries, and about 1/2 of patients detected with TB are now getting a rapid molecular test. In addition to this, access to digital chest X-ray equipment is increasing. Chest X-ray has been in widespread use for many years to screen people for TB. However, proper interpretation of X-ray findings requires trained personnel, and these are in short supply in low-income countries. In recent years, software that is machine learning enabled has been developed to interpret digital chest X-ray and issue a score, reflecting how likely any changes seen suggest TB. The user sets a threshold for scores that are considered abnormal, above which the patient is referred for a TB bacteriologic test. There are now about 15 of these computer-aided detection software products, or CAD, that are on the market and that have at least one certification from any issuing authority for use in TB. Another 8 products are known to have certification pending or to be under development. In 2020, ahead of the update of its guidelines, WHO compared the accuracy of CAD to human readers when interpreting chest X-ray for screening, using bacteriology as the reference standard for both. The range of specificity of CAD products was compared to that of human readers, with CAD products set to a threshold score that achieves 90% sensitivity. CAD products were found to achieve equal or superior accuracy to human readers, with similar or less variability. As a result, experts convened by WHO to consider these data recommended that among individuals aged 15 years and older, in populations in which TB screening is recommended, computer-aided detection software may be used in place of human readers for interpreting digital chest X-rays for the screening of TB. This remains the only WHO evidence-based recommendation for an AI-enabled product. In addition to CAD, other AI-enabled diagnostic products for TB are moving ahead on the development pipelines. Three are on the forefront and under evaluation, using real-world data in low-resource settings, namely cough sound analysis, digital stethoscopes, and point-of-care ultrasound. In recent years, WHO has released guidance on different aspects of the use of AI in healthcare, covering regulatory and governance issues, ethics, evidence generation, and pharmaceutical development and delivery. These highlight the potential of AI, but also potential pitfalls. In conclusion, AI bears promise to enhance screening and diagnostics of TB and bridge an important gap in case finding. Beyond diagnostics, AI also has potential to improve other problem areas, such as medication adherence or even TB drug discovery. New AI-enabled diagnostics are at different stages in the development pipeline. Real-world data are driving validation procedures and facilitating the continued enhancement of products and their adoption where they are needed most. The current funding crisis faced by low-income and high-burden countries should not dampen efforts to innovate and to keep scaling up AI-enabled tools of proven worth. Finally, I thank the organizers of Planet Health Innovation for inviting WHO to address this meeting, and wish you all a good discussion. Greetings from Geneva. My presentation will briefly
Thank you very much, Dennis. It's always in the forefront, and you know tuberculosis is very important burden of disease, and I think it's very strategic. So before going to the last one, I want to invite Domenico to come here, because Domenico at 6 has a call for some different issues. So Domenico, come here, please. Domenico, you know, is the organizer of the One Health International Conference. We've met in the last 3 conferences in Greece, in Barcelona, and I thank him so much. And we thank him to invite us to be the twin partner and to have this possibility. Domenico, thank you, and talk 1 minute. I know you have to leave for a call because we have been very delayed. Talk about your dream, your baby, your One Health.
Yes, no, first of all, I want to thank you, Jordi, for this amazing venue. I mean, I'm very impressed. No. Congratulations for such a great event. And as Jordi said, I'm the co-chair together with Professor Margherita Ferrante of the International One Health Conference that now is at the 4th edition and hosted here at Campus Biomedico. And we thank really greatly Campus Biomedico for hosting us and for believing in our initiative. So the International One Health Conference was born almost like 5 years ago, or is almost like, with the idea to gather professionals from different disciplines and to go beyond silos. No, I'm a bioengineer, but in our committee there are biologists, clinicians, medical doctors, architects, experts of data. The idea is that the One Health is a holistic approach. No, we need different points of views because we know that One Health is the connection between ecosystem health, human health, and animal health. And to deal with that, we have to work without thinking in silos. And so tomorrow, I'm very pleased to invite you to the conference that will last 3 days, the next 3 days. This year in particular, we choose a framework that is the integral ecology. For the ones that maybe don't know, the integral ecology is the framework that is launched with the Laudato Si encyclic. We are in the Jubilee year in Rome, such an important year for Rome, and the integral ecology is properly talking about One Health. And we decided this year to choose this framework to talk about One Health. And so we are waiting and welcoming tomorrow to our conference, and thank you very much to Jordi, and congratulations to every one of you for the amazing presentation that I see. Thank you very much.
Thank you very much. Now we have a video, and also just if Jordi allows me, there are 4 people in the room that haven't spoken at all because they are invited, no? So you you and you. If you want to have 30 seconds, 1 minute talk later, present yourself and say what are you doing, you can do it, okay? So our objective is that everybody in the room has spoken. This is very important. Jordi, we go with the last video. Fantastic. We are talking about the Amazonic Planetary Health Chair.
Ladies and gentlemen, colleagues and friends of planetary health around the world, it's a great honor to present to you the Amazonas Planetary Health Chair at the Pontificia Universidad Católica del Ecuador. This space combines international science with the daily experience and ancestral knowledge of the Amazon. Our vision is simple. Planetary health means protecting and improving human well-being while also caring for nature. Health is not only physical, but also social, cultural, economic, mental, and spiritual. All these parts are linked to the environment, which provides food, air, water, and meaning for our lives. When these elements are in balance, our communities can grow in harmony with nature. What universities now call planetary health has been lived by Amazonian indigenous people for thousands of years. They already knew that human health and the health of the earth are one. Their wisdom, based on diversity, community, and spiritual connection with the land, is what we now seek to learn from. The Amazon is not only a place of biodiversity, but also a place of wisdom, and its voices must be central in this global conversation. Our chair is proudly Amazonian. It is an open and interdisciplinary space that brings together scientific knowledge and ancestral wisdom. We welcome researchers, students, indigenous leaders, and policymakers. We believe in co-creation, no imposition, dialogue, not monologue. Our projects are developed with indigenous people and local communities, so they answer real needs and respect cultural values. We imagine a university environment where the Amazon's vision can enrich and sometimes challenge current ideas of planetary health. In this way, we hope not only to respond to crises, but also to transform how we learn, teach, and relate to one another and to the planet. The Amazonas Chair cannot be built by one person or one discipline. Its success depends on the participation of scientists, teachers, activists, indigenous leaders, students, and policymakers. Only through true collaboration can we honor Amazonian wisdom, which reminds us that we are part of a greater community of people, of living beings, of the planet itself. So I invite you to join us, each from your own role in building this planetary health chair together. That is the only way forward. Thank you very much.
Javier is always super enthusiastic. We had a small problem, technical problem, with the video of Ji-Yoon. But we will send that video to all of you. It's impressive video. I'm a bit sorry. Nothing is perfect, but 3 key points. Ji-Yoon is from a community of the Achuar nationality. She emphasized that many times, and she did not agree that we put Amazonic planetary health. She insisted in putting the Achuar nationality. And obviously, she has been empowering women in this part of the Amazonic Ecuador. And basically, there has been a small clash between the knowledge of her community with plants, with traditions, and sometimes some doctors, some nurses attending from these big cities in these rural areas. No, there has been some cases where, without any means, the community had suggested some traditional elements, plans, and there was some clash, even to the level that some doctors from the city said, if you do that, I will not take responsibility into that medical act. No? But there was a missing opportunity again of integration of both parts. I think it's important. Also, an empowerment of all this knowledge that is being lost. And you will receive, of course, this video, which is massive hyperbole video. I will ask you, all of you, when you will receive that video, we can make a collective post, no, to really highlight the importance of that fighter in that zone of the world. I think it's very important. And it really is an example of how community healthcare, she does 3 things at a time. Community healthcare, empowering women, to develop businesses with this knowledge and the creation of small objects, not only that, and also they are now having agreements with some ethical companies to develop traditional products. So with that, we will conclude the Planet Health conference. But before, as promised, we'll give the word to some of you. Come here very quickly and introduce yourself and say what are you doing, and thank you for coming. Please, go ahead.
Hello, everyone. My name is Hideo. I am a researcher at an organization called CABI. We're based in the UK. And we focus mostly on agriculture. We do agricultural development projects and looking mostly at plant health, pests and diseases. But we also have our own One Health Hub, where we work closely with the FAO's One Health Knowledge Nexus. And so as part of the One Health Hub, I helped write a manuscript, and I'll be presenting a poster during the conference this week. And so I would love to meet all of you if you're attending the conference. And I've been learning a lot from today's lunch, and I hope to learn a lot more throughout the conference as well. So thank you. I'm looking forward to meeting all of you.
Thank you.
Thank you. I'm Carolina, also arriving in the last minute, invited by Pedro. Thank you very much, Pedro, for inviting me here. A pleasure to hear from you, from your projects. I'm a journalist, so I'm someone interested in communication, so in building bridges and in making lots of what we are talking about here, right? Health, and more specifically, also working with NGOs, with the UN. I worked in the past, right, with MSF, Doctors Without Borders, so different teams and different issues. Now I'm a consultant. And I think that that what we are talking and dreaming, right, is in the sense of like imagining the day that you open the internet or you open the newspaper and what you're reading, right? It's not about the last news on Trump ideas, but it's about like the policies that were changed or not, right, in terms of care and of health and the interest of people and in terms of what can be done. I think lots of you mentioned education, but I would invite you to think also about communication in the sense of what can be done for health to have right, the space that we would need for influencing and for having a different word. So happy to meet you. I'll leave my contact also with Jorge, and yeah, please get in contact if you may be interested in some collaborations. Thank you.
Obrigado, obrigado. Journalist from Brazil living in Rome. We have Jesus, a journalist. We have different backgrounds here. It's important to link everybody. Please, next one.
Hello, nice to meet you. My name is Montserrat Mendoza. I am from Mexico, from San Luis Potosí. I am an activist in Greenpeace, Global Shapers, and United Nations. And I also a scientist in environmental health. and I'm working in a project about plastic pollution, and I'm so happy to listen to all the ideas. I think that in Mexico we live in a context that is hard, but I'm so happy to know that we can create a different reality. So thank you for sharing your projects.
Nice to meet you, everyone. I'm Francesca, and I am a veterinarian. I think I'm the only veterinarian in the room, actually. And I'm also a program associate at One Health and Development Initiative, that which is a Nigerian NGO, it has different activities on One Health and various interventions across board. And I'm here to present at an oral presentation actually tomorrow at the One Health International Conference. And thank you all, and nice to meet you, everyone. Yes.
Yeah, it's really a small failure to have only a bet. We will improve next time. And thank you very much for being here. Omar.
Thank you, Jordi. Hi, everybody. My name is Omar Rosso. I come from Colombia, Universidad Simón Bolívar. For me, it's an honor to stay here sharing with you. I am very impressed of the event. Yes, congratulations for this. And hearing all the presentation, I think that what kind of citizen we need to the next years, yes, what kind of citizens is needed to the education in elementary, in high school, at the university. We must to see and we must to prepare the new generation to the challenge that the world is having for us right now. Okay, thank you.
So he's coming from Colombia in the frontier with Venezuela. So yes. Fantastic, fantastic, very good.
And we'll be talking about the border between Colombia and Venezuela in One Health conference. I want to give thanks to Dr. Gabriela Fernandez and Dr. Domenico Video for the invitation. Thank you.
Thank you very much.
Good afternoon, everybody. My name is Camilla Lugli. I'm from Italy. I'm a medical doctor, public health specialist, and a PhD student. And my PhD is evaluating effectiveness and efficacy of continuing medical education courses on health, environment, biodiversity, and climate change. So we are trying to spread the knowledge about health and environment through healthcare workers. Thank you very much for today and for this opportunity.
Thank you. We know that you are working with Alessandro a lot. Keep pushing from the Youth Force. And I think the last one would be you. If I forgot anyone, please tell me.
Hello everyone, I'm Costanza Vecchio. I work with a group of Professor Margherita Ferrante in Catania. So I'm from Italy. I'm a psychiatrist and I care particularly about public mental health. In the kind of One Health perspective, I'm trying to think of the double-way interaction between mental health and the planet health. So tomorrow we'll talk a bit more about that. I hope that will be an opportunity to connect with other colleagues. It's really great to be here, and I'm glad to have this great opportunity. Thank you all.
Thank you very much. So with that, and I don't want to forget, just in case, Eugenio has come, probably not, just to be sure. Eugenio hasn't come finally, be sure. So I would like to thank you. Thank you, Domenico, Margherita, Gabriela, thank you for the opportunity to join the two conferences. And I would like to really, well, before the last minute speech, fantastic, thank you, Jordi. Some of us are going to go later to have dinner, okay? You are not obliged, and I know some of you have been traveling. Sorry? Without between 8 and 8:30, okay? And we have already booked a table of 10, 12, but there is enough room in the place, so if we are more than that, I think we will be that. These people will have a couple of more tables. So you are all invited, and if you want to come, it would be a pleasure to have you there at between 8:30, probably, okay? We'll have also probably the coming of Joachim Erra, which is the director of the San Giovanni di Dio order in Rome, and other people maybe also. So coming back to the last minute, I would like to really thank you again, One Health Conference. And basically also I would like to make a call to action, without really a nationalistic view, but we are lucky in Europe, and we have to take advantage of that. We are 27 countries, even more in the zone, and we are lucky to be united in this time of the history. And without any nationalistic approach, I believe we have capacity and the mission to really, now that the public health is in retreat, by many governments of the world, to really push from the bottom in a realistic way and working together with many countries of the world. And I think it's really a mission that we need to accomplish and to be positive, because there is nothing worse than to be negative in life. There is, or to go into the wave of exaggeration, nationalistic, hyper exaggeration in the sense. We have to remember the 21st century without exaggerating. I think we are in a better position. And I believe that we have to work together, and we want to do this even in every single country of the European Union. And not only that, also we have already agreements to do it in Washington, and why not other places? So thank you very much. Thank you, everybody. I hope we can see you, some of you, in the dinner, and of course tomorrow in the One Health Conference. And thank you. It's been a pleasure on Monday and end of September in university. I congratulate you and thank you very much. And of course, for some of you, and if not all of you, we will make some online interviews. We wanted to do them here physically, but it's been impossible for some. We'll make some interviews to you specifically with 3-4 key questions for your organizations. We will disseminate. Thank you very much all together. Thank you. I think some of you can make now some photos. I think some of you wanted to make photos with others. Please go ahead and enjoy.